Okay, welcome everyone. Hi, everyone. Thanks for being here. It is Monday, March 3rd, 3:11 p.m. This is a budget study session for the Boulder County Board of Health. Do a quick round of intros, board members. This is Morgan McMillan, board president. Lindy Hinman, vice president. Amber Johnson, board member. I think our other two board members will be joining us in the next half an hour here, so. Thank you, everyone, for being here, and thanks for all the prep work that went into it. Get going.
All right, thank you all. I'm Lexi Nolan. I'm the Executive Director of Boulder County Public Health. We have Armando Orfiola, our Admin and Finance Director, Indira Gujral, PD Director. We have Desiree Kazarosian, our Finance Manager, Sarah DeVore, our Budget Manager, Patrick Kunal, our Executive Assistant, Rachel Arndt, our HEAL Program Manager, Elise Walm, our, what's your title, Elise?
Health Planning Evaluation Program.
That's right, Health Planning and Evaluation. Sorry, it's too fast to rattle them all up. Stephanie Farron, our Communicable Disease and Emergency Management Division Manager. Daphne McCabe, our Family Health Division Manager. Joe Malinowski, our Environmental Health Division Manager, is on the line. Carla Guardado, sorry, is our CDM admin staff, and Mitchell Goodwin is, hi Mitch, joining us from the Office of Financial Management. Thanks
Hello.
Everybody for being with us today. Just to get going, can you advance the slides, 2 slides, Armando? Or whoever's
Patrick.
advancing slides? Patrick,
Yeah,
thank you.
it's me, 2 slides.
Study session. Yeah. So our objectives today are to equip board members with the knowledge to understand BCPH's priority-based budgeting tools, processes, and outcomes, the kinds of outcomes that you will see to support your oversight role and ensure alignment of budgeting with our agency and community priorities. Our second objective is to secure Board of Health approval for the scenarios that we have developed, which are pitched at 3 different funding levels for our 2026 budget, and to provide our staff with guidance on how we will be using reserves or could be using reserves, on which these recommendations will be pivoted. So our agenda today is we'll start with the overview of priority-based budgeting and really walking you through the tools. Armando will provide information on our current budget status and projections, incorporating some of the more recent information and areas of risk that we see. We will have a good amount of time to talk about the scenarios that we are proposing for you and to get your feedback on whether those scenarios make sense to you. We will also have a conversation about the use of reserves in the coming year and look for your guidance on that. And we'll wrap it out with a little bit of how we see this process connecting to our longer term agency vision and work. Any thoughts about the agenda or requests for adjustments or curiosities that we should address now? No? Welcome, Brooke. We're just going through the study session objectives and agenda. Just got started. Good time. Okay, then with that, I would like to turn it over to Morgan to say a few words about the board's role in this process.
Yeah, great. And I'm going to invite Brooke, although she just walked into the room, to add anything else. And it's helpful if you keep that slide up there. So thank you for. Well, first I want to high level say that as a board member, and I think this is shared by my fellow board members also, that we have come a great distance in the last year plus in terms of our fiscal management and I think the board's confidence in our management. So that feels really good. And I want to celebrate that and honor that work that got us, the collective work that got us here to where we are today. So thank you. And, you know, I think that's really great timing because we have a tough year ahead of us, we think. And So it's great that we were able to really clean our systems so that we can be in a much better place to make accurate predictions and then have some good strategic conversations. So I think that what I wanted to set for the board today is this focus on, what are our priorities as a board for the organization. I think we're going to learn a little bit about the process, but this is really mostly an internal staff process based on our prioritization and what our needs are. So I want to keep that in mind. I think the scenario planning has been really important for us, along with that reserve policy and thinking about the scenarios and what we are, how we're thinking about that reserve that we have also. And then, again, as it all ties into the vision that we have for the organization. So as we go through the exercises today, there might be some more in the weeds activities, and I want to encourage us to stay out of the weeds as much as we can and really just think about that big picture of where we need to go and how we're going to secure sustainability for the organization. So, Brooke, is there anything you want to add as my budget finance?
I think there's nothing else I want to add, except looking forward to 2026. I think we're going to be in a very different position than we were the last 2 years. And I think we're all very, very happy about that. And along those lines, I think scenario-based budgeting is probably scenarios are the most important for us.
Can I just clarify from the two of you, what is the board's remit or mandate here in terms of what we are deciding or what we are guiding from the agency's perspective? And the reason I'm asking that is as I read the pre-session package, there were assumptions being made about certain things. I'm not sure, do we weigh in on those things? Like how to think about the percent weighting of certain programs as an example? I'm just curious, like what our role, like how involved are we at that level of detail?
So I might disagree a bit, I know from what had went around, but I think, we are here partially as a representative of the public. So I think that if there's something that you feel strongly enough about, we should discuss. Maybe we don't have to discuss it today, but I do think it is something. Okay.
Yeah, I mean, I think it depends on, for me, I would discourage us from getting, again, into the percentage weighting or making, especially if it's small shifts, like if you feel like something is really off, big, fine, worthy of discussion, but what I don't want to get into is us weighing in on individual programs, because I don't think that's our goal, right? So, I think that the staff has developed a robust process to try to fairly look at programs, and they've divided them into mandated versus non-mandated versus
Infrastructure.
thank you, infrastructure. So I feel good about the process. I really don't want to get involved in changing that process, especially as it's already underway.
Yep.
So I think the big picture is what we want to focus on.
I think the process makes sense. I think the methodology, what sits under the methodology, I have some concerns about.
Yeah, and we
So
have
is
discussed
that-
that before, and so I do think that's something that will probably come up.
Okay, I just want to make sure I understand what's appropriate for this meeting and what's not appropriate in terms of the discussion we're intending to have today.
Yeah.
And I will just also mention, we have some sticky notes here because we,
Go over all that.
okay, we want you to capture ideas, right, that we can discuss.
So we'll get started. Great questions. I would have to add that there's going to be some opportunity for some dialogue. We do want to hear feedback in regards to the tools. How can we refine them? If you look at what we're going over today, the tools have been refined, multiple times. Our decision tree, I think, is on version 11. And so we started with 1. So we continually improving it, trying to make it right. So before we start, I just want to start with norming. It's important that we start norming. So I really want, your participation. And with that, I want to make sure that y'all come up with some quick rules. Sarah, if you want to write that, or Desiree, just kind of some quick norming for today, because it is a retreat. I want participation. I ask, please participate, because the more feedback and more information that we get from this group, it really guides us better to come back with a good budget for 2026. And not only with 26, there is some challenges that we'll talk about, even in 25. So, You guys can freely speak out. She'll be writing, the norming, but I would say, one of the things is, I always say, be respectful of each other. You don't all have to agree, but, in a place that a common goal is what we're trying to establish here. Is there any that you all want to hear? If you don't have any, Lexi and Dura also, since you're part of that group, right?
I think my favorite one is step up, step back. External thinker. So creating space for the quieter ones in the room who also tend to have some of the biggest insights. Step up, step back.
I would just ask that we keep in mind that, that this is a public meeting and there are lots of opportunities to go down rabbit holes, and, we are working hard to keep our staff involved, but, it's an anxious time for a lot of folks, so just be aware.
Any that you want to add, anything you can't live without as a rule?
Or be curious,
That's a great one.
asking questions. I'm assuming.
We'll move on. There's always opportunity if you want to add a rule, norming exercise. The other thing I want to add to the left or behind me, to the left of me, you're right, my left is the parking lot. And so I think I heard a little bit already as far as like, maybe you want to be curious about something in particular about a program. There's sticky notes in your table. I definitely write it down. You can hand it to myself and I can put it up there. We'll capture these. If you have questions in regards to maybe the process that we're talking about, but really we don't go into detail and you want to ask. So I really would try to get everybody on the same page and making sure that we're with the agenda or moving along on the agenda. So anything that's maybe different than priority-based budgeting, put it on the parking lot. And we'll get back to you. I usually follow up once we do something like this. I'll follow up with the report and give you as much information I can in regards to something that you maybe something that's bothering you, maybe something that you'd like to know. Put it down. So that's the only thing I asked that we stick to the agenda tonight. So I'm going to kind of get started. So again, thank you all for being here. And I do want to give a quick shout out, Mitch. Thank you, Mitch. Mitch from the county has worked tremendously with the team that I feel comfortable running reports on Oracle. And that's what we're using. So thank you, Mitch. Just want to say thank you.
You bet. Great working with you.
Thank you. It's been great. So before that, today what we're really going to do is go into a little bit more detail into these tools. Like I said, we refined these tools for this presentation. But it really essentially is these new tools of modern finance, really, because if you recall the prior years, you've all done incremental budgeting. So every year you kind of add, it's inflation, you add and continue adding to the budget. Last year, we took a big task and we looked into base budgeting, which is an extension of priority-based budgeting. And so with base budgeting, we actually looked at our expenditures. We did some analysis, a lot of analysis actually, and we came to the board with a recommended base budget, really trying to trim our budget. We actually took about 5%, which was, I think, 1.7 million, right around there, in regards to establishing a brand new budget. Knowing that, there was still room to continue analyzing and trending some of the data to come up with a new budget in 26. But with that said, we felt that there was opportunity and efficiencies to be effective as an organization. And so today we're going to actually kind of go over the priority-based budgeting. So one thing I want you to keep in mind as we continue moving forward, the challenges that we're also seeing is the 25, some of the unpredictable, the changes in government. So all that does have an impact on how we're going to implement. And I'd like to go over that today also. And so with that said, next one. I'm not going to spend a lot of time on it, but as we talked before, this is the previous slide. I'm going to go high level. I don't want to bore you. I don't want to talk. I really want to work on the groups. So priority-based budgeting ultimately is a budgeting approach that allocates resources based on programs alignment with organizational priorities and community values. And with that said, we have some tools that we've developed to be able to capture that and then also ultimately making sure that we have funding feasible. So the benefits are improving transparency, strategic alignment in high needed and high priority programs and activities, efficiency, optimizing resource allocation, enhance on focus, no long-term or no longer long-term goals or innovations, and then matching with the budget. So that's probably the biggest thing, is really making sure that, we're doing more with less ultimately because of the budget restraints that we have, but ultimately making sure that we prioritize and we're maximizing on what we're delivering. Y'all seen this before. This is kind of just I'll go to the next one. So this is kind of just the foundational ground of priority-based budgeting. Really just the three phases that I want to talk about in this, that foundational. We talked about foundational earlier, really started when we adopted the first budget, and that was December, and really looking into, setting some clear expectations. We've sat multiple times as a group with the directors, managers now, management team, and really looked at, setting and defining some of these metrics and making sure that we've had a full, complete inventory list of all our programs. That was kind of the foundational phase. The framework is really where we're at right now. And I'd like to expand on the framework. It has multiple functions, but right now we've developed the scorecard, we've tested it, and we've continued to improve. And we've also done inventory in all our programs. And I'll talk a little bit about our programs, but they continue to grow. And when I say that is because we start finding that within a program, there's sub-programs. So although we budget on the program level, we've seen some inconsistencies, and we've addressed that with this new inventory. So we do have a list today that will provide you with actually our first preliminary scoring. So you can kind of look at, our mandate, our non-mandate, and then our infrastructure. Sorry, I had a brain. And then ultimately, within
Everybody knows the answer.
said it enough. And then ultimately within the next few months, really the goal is to get a recommended budget for y'all in end of May, because I'd like to have a preliminary budget to the county by June. I'd like for them to have a real 26 budget. So when they start moving forward with theirs, they're not waiting on us. They exactly know what the agency's needs is, and hopefully we can have a successful budget process within this year. And then ultimately the implementation phase. This one's a little tricky because we have not only budget 25, but we also have budget 26. So we'll be doing implementing multiple phases of programming and updates. So that's something that we'll continue to evolve and evaluate. Next one, please. Okay. So these are some of the old slides that you looked at. So I'm not going to go into too much detail, but I do want to talk about the four, I'd call it three, with four being kind of the category tools that we used for priority-based budgeting. Priority-based budgeting obviously is trying to really get a better grasp of our inventory of what we do. And I think I've heard that since I've got here originally from the board, really saying, what is essential, what is not essential, what are we doing, what are we not, what services are we delivering? And so ultimately what we ended up coming up with is three categories. And the first one, won't talk about them in this slide, but so we developed the categories, the scorecard really shows value. We'll go over the scorecard, and actually we'll have an opportunity to kind of score two programs. I want you to kind of understand the methodology behind it. And then the decision tree. The decision tree is very important because it really is taking all the information that we've done on all these programs and really assessing them and coming up with recommendations, and ultimately providing some target percentages to our programs. And so that way they can actually work with some recommendations that we can move forward and ultimately build a budget. And then ultimately the funding metrics, which is very important. That really is it feasible? Where's our funding coming? Where's the gaps in funding? What programs have funding? And so all that is very important. And I'll go over that funding gap also. If I'm going too quick, please let me know. We've looked at these, but I'm trying to speed it up a little bit. So I will talk a little bit about the program inventory category because we'll have some time to discuss. So what I want to talk about here is I'll set the. So we have three categories that we lumped all our programs or our inventory program. And when I say programs, I just want to be clear, I don't want to confuse everybody, is we use programs how we budget, but within each program, there's multiple sub-programs. But because of priority-based budgeting, we have an inventory of programs. So I'm using the term programs very loosely, which incorporates programs and then also programs that we have budgeted for. Yes.
Yes, and the reason that we're doing this, just to be clear, is because some of our kind of what we would call a traditional program in our agency might include multiple. It might include some work that's mandatory, some work that's non-mandatory. And in order for us to categorize the program, we had to break it into pieces.
And so with that said, one of the infrastructure, one of the categories is the infrastructure program. And really that is the essential operational services. That's the support in order for us to deliver our mandate programs and non-mandatory program. And so, for example, that is more of your budgeting, your finance, your accounting, your procurement. And so they're essential, but when we didn't score those based on value, because ultimately we originally scored them the first time. We'll talk about that, but if we would have scored them, obviously they would not scored very high when it comes to value, right? Because there's no value out to the community. They don't see that. It's behind the work. So the second one that we came up with is mandate programs. It's required by law or regulation to deliver by local public health agencies. So we'll talk about some of those programs and we'll obviously provide you a list. I think you got a list in last week's email where we broke down all the inventory programs or all the program inventory, all the program inventory with all the categories. And then non-mandatory programs, that's discretionary services enhancing community well-being. So those obviously we don't have to do as an agency, but they score very high because it's a big value to our community. And so obviously they have big value. So we'll talk a little bit about those programs, but that's the three categories that we identified and we broke down our program. And just to give you a little bit of data, so within our categories, we have 24 programs that are mandatory. We have 42 programs that are non-mandatory. And then we have 14 programs that are part of the infrastructure. And as you can see, those are, so
Next slide.
oh, no, he's there.
Okay.
So what I really wanted to illustrate here is a little bit is to give you an idea of what the cost is. So what we ended up doing is breaking up the 80 programs and actually assigned from our budget. So if you add that up, we should be at $24 million. So that's what it costs to run public health in 2025. And so as you can see within mandatory, we out of the 24 programs, it cost us 5.9 million. Non-mandatory cost us 11.4 million, and infrastructure cost us 7 million. If you look at the percentage, I was going to break it down into percentages, but as you can see, the pie graph is based on percentages. Sorry, we didn't update that. That should have been updated. That's my fault. As you can see, non-mandatory, a little bit over half in our, or right under half, but percentage-wise, if you take a look at our total budget.
So the non-mandatory programs, the programs represent over half of our programs or sub-programs, and the amount is less than half of our budget.
So that's a reflection of the number of programs, not the.
Correct. The number of programs, yeah.
Armando, are we going to go through by category, how much is grant funded? So how much of that 11 million is grant funded?
Not I do have that information, but so let me just,
Funding matrix.
yeah,
By category?
by category, yes. But it's not into full details, but it's by category. So just to test it on my, so it's 53% of our programs are non-mandated. 30% is mandatory, and then 17% is infrastructure, just to give you some numbers in percentages. Questions on, I will go over that list, so I'll definitely have that for you.
Just on the infrastructure, just on a benchmark, I'm calculating that's 20% of our overall budget. How does that benchmark to other departments of our size? Do we have any?
We don't, that would be the next step. So when we get to the decision tree, I definitely agree with you. Because keep in mind, depending on how we move in a direction with priority-based budgeting, we have to adjust that. So depending on the size of a program, that should also determine the size of the infrastructure.
Which one is correct? Is the text correct or the pie chart correct?
My chart reflects the number of programs.
No,
Not
the dollars.
No, I know, but the dollars are the same. It's
The
just.
dollars are
pie
the
chart
same.
Reflects the numbers.
No, they're not the same. They're wrong. They're incorrect. Which one is correct?
The pie chart is based on the number of programs, so the 24, the 40.
No,
The dollar signs are incorrect.
Mandatory.
Which one is correct?
Mandatory says 5.9 million in the list, but it says
Infrastructure.
70 million
Got it.
in the pie chart.
Yeah, which one's correct?
Labels are wrong.
Well, which one is?
Give me one, let me
Yeah,
make sure
sure,
that
check.
I give you the numbers.
This is the last minute change for us, right? So I apologize for that. If you think that's out on our side.
Mandatory is 7.055 figure.
So it's correct in the pie
That's correct on
chart.
it. Thank you. Infrastructure is the 5.9. I apologize.
And I assume the program numbers are incorrect as well, that there's 14 programs under, or is that correct?
No, that's
14.
correct.
Okay.
That came from the pie
And
chart.
the size of the pieces of the pie match the number of programs on the left.
Questions on that? Any other questions? So I'm actually gonna go to the next, the real tool. I think this is actually really our first tool, and that's the program scorecard. So we've actually looked at this before, but I kind of talk a little bit about it. So like I said, we're in a couple of iterations of this. Originally, we had multiple criteria. We really talked about the scorecard being more of adding value to a program. How does it have value to the community? How does it impact the community? How does it impact address public health? So what we ended up doing is looking at where we actually shrank it down to 4, and that's the strategic goals, which is to what degree is the program important for achieving our strategic priorities? Last year, I believe last year, the year before, you went through a full adopting a strategic plan. And so that obviously carries on to the scorecard. It's priorities that we promise that we deliver. And then community impact need. This one was something a little bit different. So we added, the criteria is 40%, but we added individual criteria to come up with that. So like the significance of the problem addressed in Boulder County. So not only do the program managers have to get this information, it really helps provide us a good data to be able to really score this proportion of the county affected by the issue. So obviously looking at the program, how does it affect? It's also 10%. And then reach to affected people, what type, how does it affect it, that number. So we're trying to use data to actually score this. And then health acuity of the problem or contribution to lifelong health and prevention. So that's all these 10%. That's some of that external data that we use to actually grade this. And then the equity considerations. To what degree does the program improve the equity in our community, which is very important? And then ultimately innovation. We kept that. We thought that was important. Does this program represent innovation in the work? Boulder's known to being very innovative, and we still thought we should keep that as a value. And so you take all those 4 criterias, and that's how we scored all mandate and non-mandate programs.
This is different than what you presented to us, the subcommittee. Correct?
No, this is exactly the same.
No, I think, aren't the percentages different now than what we had?
Just
at
the
subcommittee?
community impact is broken out, that 40.
That's the only thing we broke out. We didn't have it broken down originally. It was originally 40. All we did is broke out because we assigned 10% to each one to equal the 40%.
I thought community impact and innovation were higher than when we were originally presented, and equity was lower.
No, I can go back, but the only thing we added was the 4 is the 10%, because originally we had an internal formula in there and it's difficult for people to score it. And so we broke it down, and you'll see on the scorecard, I do provide a scorecard because you're going to score 2 programs, and you can kind of see how it affects the scoring.
So Brooke, I don't think it's different from the last time we presented it, but I do think that we've we've,
Because I wasn't
Worked.
there till last one.
we've adjusted the numbers since the first time.
So the first time when I presented to y'all, remember the very first, it was the board of health meeting. It was different from that one because we moved it over, because I gave an example.
I think you showed one two subcommittees ago that was.
Yes, so you did see a different one on that one.
I did.
So we had 5 criterias because we had another criteria, trying to think, it was funding. So we separated the funding from the value because we have a funding metric that really gives us a better, defines more where the funding is at, because we couldn't score something based on just the funding to get value. So we wanted to separate value to the community versus the funding and feasibility. And that's what we did. Yeah. So we'll go over, you'll have the opportunity to look at the funding metrics, and you'll see when we do the decision tree, why we separated it.
Can I ask a few questions on this? There wasn't a lot of information on this, and this is fundamentally very critical as far as I can ascertain in terms of the methodology. What do we mean by strategic priorities?
So the strategic priorities are the 6 strategic priorities that y'all adopted last year.
In the strategic plan?
Correct.
Have more discussion on that when the time is right.
Yeah, I think it's hard to talk about the scorecard until we see how the programs get ranked based on this.
Okay. So maybe I should just hold then until we get.
No, I put it on that sticky and I'll put it up because I want to make sure I don't.
Yeah, I do want to say that we had a lot of discussion around the scores. The problem is that if you just go off of strategic priorities, the result, it won't pick up all the core services.
I think it should. My
Yeah.
personal opinion is it's too high.
You think it's weighted too high?
Yeah, I do.
Yeah, and I think what I like about it too is it gets to the community impact. Because the community impact, you could have, like, for example, one of our programs sees all the teens that have, new parents, right? That's pretty high community impact. The number of people being served may be, decreasing, but we're having a huge impact in the community as we're seeing on. And so having strategic goals, having the community impact, and having the equity piece was really important to us because those are aligning with our values and our strategic.
Do we have, and I'll just leave it at this question and then we can move on for my questions, but until we get deeper into this, but do we have a specific definition that could be quantifiable relative to community impact?
So community impact is actually made up of 4 scores, and I can go over that now, or we can.
Yeah, so we have you will in the next. So our next slide, we'll talk a little bit about, we'll break it down so you understand the 4 scores and how they're made up, or how we make up the score for that. So.
I'm sorry,
Yeah,
one
keep going.
question before I forget to ask this, how are we accounting for interactive effects of these things? So like you may say, I think the example you just raised might be a good one where you have a community impact, but there also might be an equity impact as an example. Like how are you factoring in programs that might impact multiple scores?
The equity one is hard because if you ask every program in the agency, they will tell you that they have an equity component to it. Right. So when we talk about importance in advancing equity, what we're talking about is that they have a specific strategy that is working towards eliminating a disparity or doing something to improve the lives of people who are disproportionately impacted. Right. And you're not always going to see that in the mandated space. You are going to see that in the non-mandated space. Right. But the striving for equity is important because we want to make sure that programs have a specific eye on the ball with equity.
So,
Yeah,
but
if I heard your
I
question,
think my question's more mathematical, which is, how
they're
are you,
oriented.
they're at.
So these are each 10%. So if you have a high equity score and a high community impact score, those will both contribute.
That'll weigh into the score.
But there's an interactive effect potentially between those 2 scores, meaning you could double count. You could say this had an equity impact, it also had a community impact.
You can, but it rolls up to 40%.
I'm curious.
I don't.
Yeah.
When we look at the, let's talk at
I
the
just want to,
Sounds good.
I'm going to continue
Yeah.
to zoom us out because I also think what I want the board to think about is what is our objective in this process? And to me, it is about building a sustainable budget. And I don't think it's appropriate for the board to weigh in on what programs are staying and what programs are not, as long as the staff feels like we have a tight process for reviewing programs that can be justified, because I do think like we need to keep our eye on that bigger picture of.
Yes, and I would agree and I disagree with that, Morgan, because we're representing the public right now, and if the public doesn't see it the same way, right, in terms of how these things are weighted, I think it merits a debate. I think it's appropriate to debate that, right? Like I'm not even debating it right now. I'm just asking questions to say, this is the undergird of some of the methodology that then determines what gets prioritized. And I do think it's important for the board to feel comfortable with that from the community side.
So I used to think that, but Armando has reframed me. Because when we first started doing this, I also thought that the scorecard was gonna have some type of decision-making piece, but it's not. The scorecard is gonna be used in conjunction with the decision trees and the funding matrix as a collector.
So it's an input.
Yes, as a decision and a recommendation later on in the tree.
Yeah,
And we'll have a whole exercise in a few minutes where we're gonna ask you to,
Yeah.
bring all of this stuff.
So I guess to close this slide, I would say is like division managers, along with the executive director and deputy director, contribute scores for each program based on these criteria, and we'll go over those. But it's important to note that these scores are not intended as a hard and fast rule for determining funding allocation. That is probably the biggest thing on this slide to take away, but it does give us a value of what we're providing to the community, like you said, your constituents. What are we providing? Do they agree on what we're providing, the value for these programs? Next, please. I'll go back. Sorry, my head. I'm one.
all right.
Yes, go ahead too. Okay, so I'm gonna hand it off to Indira, because she's gonna go over this scoring a little bit.
Yeah.
For y'all.
So one of the things that stood out to me in this GFOA document is about identifying your priorities, right? And if you asked us what our priorities are, right, a lot of people go straight to the strategic plan. But the strategic plan has the 6 priorities that don't include core services, which we would also say are priorities. And there's a lot of equity work happening in programs that we also don't always count. So the purpose of the PBB is just to start getting us in the scorecard, is just to try to get us on the same page. So what I'm going to do is hand out a example. We took one mandatory one, which is emergency management, and one non-mandatory, which is the
What we're
tobacco.
really gonna do is break it up into 2 groups that we're all together, so you guys.
And then the other one is the tobacco. And so what we want to do is just give you a little bit of context, right? So emergency management, it supports the agency, it supports the community, helps us prepare, helps us respond. A BCPH response may be necessary to support our jurisdictions within Boulder County, regardless of where they are at. And these can occur at any time. They also include human-caused disasters, as well as natural disasters, medical emergencies, terrorist threats, biological weapons, which we have actually had. We've had cases of ricin and, right, remember that? We could have nuclear, radiologic, which is also something that we've been, planning for over the last couple of years. It's high on the CDC list. And then there are just, all kinds of incidents that can happen, like active shooters and things like that. So I put in there, does everybody have one? You need one on one?
Yeah, and then also there's a scorecard on the left-hand side of the binder, so we can score that one.
Yeah.
Okay, take a look at it.
Before we score it, so the last piece of context with that one is that Boulder County has experienced a significant increase. So I've been here for almost 11 years. We have had an increase every single year in the number of natural and man-made disasters
we've had pandemics, fires, floods, blah, blah, blah. And then just to give you an example of a lecture, in 2024, there were 10 activations. Just last year. So that included power outages, heat advisories, cold weather sheltering, we had a train derailment. We had to respond to the general election concerns that Homeland Security was bringing up. And then also we had TB, tuberculosis cases. So BCPH is responsible as part of ESF 8 and ESF 10 to respond as part of the Office of Disaster Management, which is the countywide response. And then we also hold our own department operation centers when we have something that is specific to us, like the recent hepatitis A outbreak that we had. We don't involve the rest of the county. We just take care of ourselves. So thinking about that context and thinking about your scorecard, take a look at the scorecard and see how you want. Let's maybe go back to that before the scoring. Yeah. Yeah.
Bigger.
Yeah, a bigger version.
Yeah, it was hard to get everything in. Let me send it to Patrick.
Do you want to borrow these?
I can't even see it either and I have.
Okay.
Patrick, I'm sending it to you.
So basically, Armando, we wanted to do, does emergency management align with the strategic goals?
Keep in mind, it's a scale from
Now,
1 to
this
5,
is
right?
not a group activity. This is an individual activity. And I will give you a hint. Emergency management is one of our strategic priorities.
Wait, but can I just clarify? It shows up in the strategic plan.
Yeah.
But what is it exactly in the strategic plan? Because
Yes. So what we learned from all the disasters was that we need to fix our infrastructure and how we respond. Well, that's what we learned from COVID. We also learned that we have opportunities to do embed equity in our responses. So thinking about that and thinking about the score from 1 to 5, with 1 representing lower.
I'm sorry to press on this, but just
And a list of the strategic.
Yeah.
I didn't get it yet, Armand.
I guess what I'm trying to set that here is the description of it is it's the statutory authority
Are you connected?
for
Okay.
this, right? Like what's really required is a mandate. And my memory of the strategic plan is it's mixed. It has certain things that are mandatory, certain things that are not mandatory.
Yes, it does.
Although,
So,
It's a
okay, so mandated doesn't show up as a criterion in the scorecard because we have already separated all of the mandatory and non-mandatory
as a category. So if you, as an example, like let's say you had a health equity component to this area, that would be separated out from a budgetary perspective as non-mandatory.
Yes, the funding, so the funding metric separates mandatory and mandatory, non-mandatory funding, and I'll show that later on. Because that's when we make the decision when we get to the tree. So right now, what you're doing is providing us to add some value to this, how it's going to score to the community, right? So for example, when you score the strategic priorities, if we have six strategic priorities, let's just, if it has one, say it meets one of them, then I would give it a point, right? If it meets 2, I would give it 2 points. It's not equally, you can do 1.2, but because there's 6, you give it a point.
But isn't one of them equity? Isn't that already covered?
There's another section of
Well,
equity.
No, I know, but so then.
no, there's a distinction because the equity work in the strategic priorities is really internally focused on how do we develop our agency, which is different from equity impact in the community. So if somebody's doing equity work that's focused on internal change process, they would get 2 points for that. Because up there, the scoring rubric is 2 points for strong relevance to each of the 6 priorities, maximum of 5 points.
So what are the other 5 priorities that we're scoring on?
Emergency management, community engagement, mental and behavioral health, stewardship, transparency and sustainability, and climate action. Those are the 6 strategic priorities.
should we print out the strategic priorities and objectives, right?
I don't think you need
Sorry,
to
are
do
we-
this exercise because we're just looking at emergency management, tobacco education and prevention.
Can you say them again, Lexi? Sarah's gonna write them down so they can remember this when they're referencing.
Stewardship, sustainability and transparency,
Influence to stewardship and transparency.
Okay. Emergency management, climate action, mental and behavioral health. Equity, health and racial equity, and community engagement.
Still need glasses to read that. I apologize.
We gotta reach back in closer. Okay.
So these are the score guidelines that we provided to programs. And the way that we ran it is Indira and I have scored all of the programs, and then the division manager or director overseeing each of the programs has also added their score in consultation with their staff. And these were the guidelines that were provided for each of the criteria.
Yeah, and it's still hard to see, but the idea is that for each one, a 1 represents low alignment or impact. A 3 represents moderate alignment or impact, and a 5 representing high alignment or impact. So if you think about emergency management and and we're not gonna have a quick discussion, we're gonna have you.
We will after.
We will after, but just go through and think about how much is aligned with the strategic priority. What are of the 4 measures of community impact, how do they score? How does it score on equity and how does it score on innovation? And I gave you limited information, right?
Well, I mean, I think that's the point, though, is that all the board has limited information. We really don't understand the details
And
going
it's-
on in the programs. So it's hard for us to do this exercise, but it's important for the board to understand what the process.
Exactly. And so you can make whatever assumptions you want. That's not what you end up scoring is not the important part of the process. It's what occurred to you in the process of scoring.
And you're gonna have differences, right? Lexi and I have differences and I'm a very generous scorer, right? Like.
I ran standard
And I'm not.
deviation for everybody when they ran them. And I can tell you that we do have those that are very generous versus those that are not. Lexi is not as generous as Endura, but I did run standard deviation and I'm also running it with the program managers because I think it's important to point those out and have a discussion if we're off. But I think for the most part, I would say out of all the program managers, when they scored this, I think they're pretty much in line. There was nothing that was really outside the deviation of 1. Which I would say is very minimal, just to kind of give you an idea. I know you don't have the information, but the program managers, when they graded these, they have that information. That's why when I originally graded it, I kind of took myself out of it because I don't have that information. I know the finances, but I don't know, the population that it affects. So it wasn't fair for me to grade that. I mean, I did grade them at first, but I pulled myself out because I don't think I'm the subject expert to do that.
And then they just add across.
Yep. And then,
And this is just an exercise. There's a lot of context you don't have. That it's okay. It's just
So I
to,
just say, make notes when you have, when something occurs to you. Like Lindy, I think it's, fine for you to say, maybe strategic priorities shouldn't be 25%. That's fine. And then as you go through this process, it's like, what questions are occurring to you from a board member's perspective about the
and we'll have some time to discuss, because I would like to hear, you're thinking strategic priorities, it shouldn't be 25. What should it be? Because we want to make sure it obviously adds up to 100, but do you feel that maybe community impact should be lower or higher? I think that's a good discussion for this board because it gives us value, right? Because what we're trying to figure out is what is the value to the community, and you're representing that community.
all right, do you want them to do the top 1
Yep.
now? Okay, so then moving on to the tobacco education and prevention partnership, you have a little blurb there. I would just say that the strategies that the TAP program uses are very policy driven, which is really, one of the best ways to impact public health efforts is through policy. So seeing lots of positives with their work in secondhand smoke, making sure that youth are not accessing tobacco. They also have done a lot of innovative work They've done a lot of innovative work with vapes. So the disposal of vapes, in fact, they are starting to win awards for their work on disposal of vapes. And also there is an education component to it. And so really just trying to support youth to quit and support youth from ever starting. Okay, take a look. And then you can, oh, how can they score?
I'm doing it right now.
Oh.
So once you have it, I'll take it and I'll score it.
They haven't scored the tap.
Oh, okay.
Oh, you did?
They did.
Okay. Okay. Sorry.
I have some overachievers here.
I know. All right. Done.
I mean, I don't know if it's worth me participating, is how I feel, because I really,
No, they're gonna, I think, they're not gonna, are you putting their scores individually? or-
No, I'm doing an average.
You're just doing it.
I hear that. I hear that. I mean, I do, again, like, I think the important part for the board is if you want to make adjustments to the percentages, that's worthy of discussion. I think us weighing in on what we think in individual
Yes.
scores is kind of like a.
We
style for us to do.
totally agree.
Yeah.
We just wanted you to have the experience of what it's like to go through the process. So we might move, why don't we move on to the reflections on scorecards?
So let me just write, so based on what I have here, it's three of them. So for example, emergency management mandate came in at 3.9. Based on just very few, not a lot of information. And then your non-mandate, the tobacco education and prevention came in at 2.75. So the discussion would be based on, limited information you have. Is that kind of close to what when you were grading it, do you see that average? And this is only 3 people, right? There's obviously 2 other individuals that are missing, but that kind of gives us, so what we did is that's what we did with the groups. And so we got the weighted score. We took all this information. I actually ran, the standard deviations and came up with, where are we at? And I would say within the deviation, we're very close in all. And that's taking individuals grading their own programs and to having Lexi and Indra doing the overall for all the programs. So it is valuable. You'll see that the next slide, I'm going to hand out actually the preliminary scoring, and you can see it from top to bottom for each individual mandate, non-mandate, or mandatory, non-mandatory, and infrastructure. So you can see, or not infrastructure, we took that out because really infrastructure is impacted by depending on programs. So we did take that out. But so I don't know, I'd like to kind of hear, I think you have some, I'd like to hear a little bit more about what you think on the weight.
I mean, to understand what the results were, where it sounds like across each program, there was a very consistent scoring, that your standard deviations were not significant.
Correct.
And so what I'm seeing the value of this exercise is it's not so much about how these things are weighted, although it's important to have some methodology of some kind, but more about, is there alignment from the people that are close to these programs around how they should rank? And then that starts to inform you in terms of how to actually prioritize programs, right? By the people that actually are closest to them. And if you have enough, now, I mean, I think there's going to be rating bias here for sure.
Well, that's what we thought
So,
originally. I think.
Right, well, but if you, these programs are being rated only by the people that know them, correct?
Correct.
So to me, that just inherently, there's some rating bias associated with that. But
That's part of the reason why Gary and I were in the mix with it, was
Right.
we could provide, kind of a much more kind of agency level.
And I would actually throw a little,
you understand what this adds,
Yeah,
right, to the process overall, which is really helpful.
And I think it gives you one piece of information.
yeah.
But then it makes you start asking questions.
Yeah, I mean, it's one input.
it's
Right.
only one input. And then I'd just actually even throw a little further is that, I actually graded them. I had Desiree grade them or score them also. And I ran the deviations to see if I was completely off. And I don't know a lot of the programs, so I would not say I'm an expert. But actually the deviations were still pretty,
It started to make
yeah, so it made sense. And so I had to pull mine out because obviously I don't know them, but I would say based on that limited information that I have, I was pretty close.
Rhonda did score all of the A.
I did score mine, yeah.
Good.
it's very hard to comment on any of this.
Yes.
You're talking about the scorecard being a small percentage, then it runs through the decision tree, then you have to look at
That's right.
mandated versus non-mandated. It's hard to comment on any of this without seeing the final outcome.
Fair.
And if the final outcomes look weird, then it's like, okay, wait, maybe now back up. Why?
Yeah, and I think it's totally fair to say, like, yeah, I mean, I think it is totally legitimate for the board to say, oh, I would switch the strategic priority weighting with the community, but also in the big picture, it might not make a difference.
In terms of the final outcome,
Right.
if we see things that look weird.
Exactly.
Yeah.
Like they should, probably, then it's not, yeah.
So-
But it does help you answer that question, what are your, it starts the questioning, what?
It also helps us see into the staff thinking, which I think is very helpful.
Mm-hmm.
I would just say that, right? I mean, we need staff as experts to obviously be a very strong voice in this process and the ultimate results. So I appreciate that part of it as well.
So I guess before we move on to the actual, I mean, are you all comfortable with the way the percentages are based on what you kind of,
Don't know.
okay.
See what the outcomes are.
So I guess let me ask you, are you trying to manipulate the data by changing?
No, I'm not trying to make
percentages you didn't like?
because if I was making the scorecard, community impact would be much higher.
Yeah, me too.
Because
Well,
this is. a
that's what I
public-
need to hear though. That's the discussion. So can you give us why?
I thought it was higher when we saw the
40%.
original one. Yeah, I would make it higher. This is the public health department. I would make community impact the highest.
Can you write that down? I think.
And I would make it higher.
So
Yeah,
what would be a good,
that's-
what number would you see it at?
Like 70, I would put community impact at the very top.
I would agree with that too.
Yeah. And I feel like when we saw it before, it was 50 or something. Yeah, it is a public health department. But I'm saying I don't know. I don't see what the final prioritization is.
And that's what I'm trying to get you not to look at the final, because
Right.
then we're trying to solve something that you've already seen. So that's why we're trying to find a good number. But I do like that. Those are good for me.
Community impact over 50%.
Okay, perfect.
It's a public-
That's good. That's a good discussion.
I mean, I guess I would want to ask them, where are you taking away from? Because
Yep, that's my next one.
I would take away from equity and strategic.
Me too.
Okay.
I know that's not a popular answer, but
Because I know it's internal versus external equity, but you're still double counting for equity in there.
No, they're very different.
I understand, but I'm just saying that as a community member looking at my public health department where my tax dollars potentially go, I would want to see community impact over 50%. And the strategic priorities should reflect community impact.
Yeah.
So I would think that by boosting up community impact, that's where.
I guess I would say then, if you wanted to boost up community impact, I would integrate equity into it then as part of that community impact, because we can't do public health unless we're focusing on inequitable, health outcomes. I mean, that is the root of public health, is that we're trying to address the inequities that are leading to.
In the community.
I
Yeah.
think Amber had a question. She's been holding it.
I have a question. I mean, I agree with this process. I mean, I think because my day job is public health, this makes more sense to me. I think that we have to start somewhere making this an objective process. And I think this makes a lot of sense to me. I agree with Morgan that equity is community impact. I mean, I think it's like a very nuanced categorization here, because all of them in the end, you could argue that it's the same thing. But I agree with the percentage breakdowns here. And I agree because equity could probably be compiled into community impact. I mean, I think there's a bell curve here, right? And I like what you're saying about we are getting that narrowed standard deviation.
And if you did integrate the equity and community impact, it would be 65%.
Which is close.
Is that what I'm hearing? I'd like to kind of get some consensus, because as we continue moving, we're on a very tight calendar to make sure that we grade these, move them forward through this tree, and move them through the metric or the funding.
Yeah, I mean, I would be okay with integrating equity and the impact and making all 5 categories equivalent.
10, 10, 10.
Well, no.
Or
equity
even,
would be-
or more.
Yeah, I mean, you'd make the, but like the way we have the 10, 10, 10.
5 or 70, and take a little bit from strategic priorities to make more.
I mean, to me, the 2 middle columns of community impact is equity, right? The percent of the population that's affected and the percent of population that's reached. And that is what we're looking at for equity.
Yeah, but The reach may not necessarily represent the prioritized populations that you need.
Yeah, they're distinct because the percent of the
That's the whole debate we
population affected is how widespread a problem is this, but it doesn't necessarily capture the inequities. And the
You could
percent of
really
population reached, you can,
Yeah.
if you don't incorporate equity principles into your strategy, then you could be reaching a significant percent of the population, but it might not be the most vulnerable people affected.
Are the ones that we need.
Right, we
Or the
might have
ones
like
that
really
need
high
to-
vaccine rates among people who are
And
not
lots
in
of-
poverty, but we have low
So,
vaccine rates among.
so let me go back to strategic priorities. We leave it at 20. I mean, we have a strategic plan. That's why we thought 25 was good, right? Those are goals that we promised the community we were going to do. So we left it. You guys okay with 25?
Yeah, I'd like to make a proposal. We also react to. Community impact at 40. Equity. Need community impact to 50.
Okay.
Equity stays at 25, strategic priorities goes down to 15, innovation at 10.
So what I heard the board saying though is equity would be a component under community impact. And that there would be equal distribution among the 5 components then up to 7, that make up 70%.
So it'd be 65. We distribute 65 among 5 is what I'm hearing.
Equity, but I'll throw that out there. I'm
All right.
overweight equity over some of the other community impact
I would
cases.
too.
So,
Personally, yeah.
but I am open to pushback on that.
I would overweight equity because much of what we do isn't forcing us to
And then the other one.
address disparities or go and serve those who are the
25.
most disproportionately impacted. So by
25.
overweighting equity,
Be rolled
you're
up.
recognizing that programs who are doing
Community
that
impact. And then
are having
innovation.
better community impact than other programs who may not.
Yeah, that's-
It's like addressing social
This would be-
determinants of health, that we need to
Yeah.
recognize that the impact that has on public health outcomes.
And 25.
I
And then-
would still go for 65 and equal weight throughout.
Okay, there's 2 of them. Did I hear another one?
Yeah, if you're looking at something that's reaching 70+% or 100+% of the population, that should be equally weighted as something that is a 5 in equity as well.
I kind of tend to, I lean where Brooke is. The reason for that is I think there needs to be debate about this from a prioritization perspective with very limited funding, right?
Yes.
Like we are going to be facing an increasingly very difficult budget situation, as I know we all anticipate. And we're going to potentially have to make some very hard choices. And I think this puts it on equal footing to say, we've got to look at overall population impact and we've got to look at equity, but we look at them equally, right? And we will make decisions weighing things in a very resource constrained environment. And I know it's hard to have that conversation right now, but it feels like the right conversation to be having in the context of what's going on.
I totally agree with you. And in face of diminishing resources, I'd rather see us focus it on people who have less access to resources.
I don't think we're saying we're not, that it would put us on equal footing with other considerations that we have to look at in a resource constrained environment.
During COVID, when we were doing the vaccines, we told the public, if you have a car, if you have a computer, if you have health insurance, just go to the pharmacy and get your shot.
Please don't ask public health to support you.
We are not supporting you. We are supporting those that are the most vulnerable, highest risk, the IDD community, the, people who really needed specialized clinics. So that to me is an equity perspective that we have to, I think, keep with limited resources.
Totally agree with you, Andrea. I'm going to ask the other 2 board members to weigh in on this.
Yes.
No, that's okay. But I agree. If we have to face again, a really hard budget situation, I want to prioritize those people who are more vulnerable than the general public, which in Boulder County actually is quite wealthy and has great access to resources across the board. And so we should focus our resources on those people.
I think that the overweighting activity to address social health is sort of the point of public health, like people who, you might be able to vaccinate all the way people in Boulder County pretty quickly, in case we send a public service, they consider it harder to reach people who don't, who don't have resources. Gonna take more work. That's where it should go, because the resource will get it elsewhere. Not from it.
Research shows too that if you develop your work with equity principles in mind, that you will tend to pick up a little bit more of the population. And when you try to achieve population health goals, if you aren't focusing your work on disadvantaged populations, on heavily impacted populations, you're actually not going to be investing your dollars in the places that will move the needle on population health, because you're going to be investing your dollars in places where there are other folks investing their dollars or where there are already resources. And so by focusing in with equity, you're actually advancing population health more effectively. Which I think is to your point.
Yeah, I would heavily weight equity and I would vote for the left-hand column. Which gets us to.
The 70%. We have consensus.
Sure. I just don't, I understand what you're saying, but isn't that what public health does anyway? Because I mean, I don't think a lot of your uber wealthy residents are seeking out public health for a lot of
Like,
services.
I think COVID's a perfect example. Like, if you could drive out to Stasio Field with your car, I bet if you looked at the people who went out there versus the people who were getting it
It's
in the
not an
grocery,
ongoing program.
but there are gonna be other things.
Yeah, but those
I
are
think
on a
that's a perfect
case-by-case
example of
basis.
showing that, like, you probably reached more residents, like, but.
We had the highest rates in the county.
But the people who really needed to be getting that testing needed it closer to home. It needed to be identified.
But that's not a
different
standing
ways.
program, and this is to evaluate standing programs that we have to write into our budget. That would be something that would happen to have a
But
pandemic.
it applies
You don't
to all
plan it,
things.
so
It
you
applies
can't
to all
plan
things.
things
Like, it
on time.
applies to tobacco. Like, are you just talking to people through via NPR? You're gonna reach one population of people, or are you reaching out to kids who are really affected in the public?
But that's within the program itself. This is to rank the program as a whole. You know what I'm saying? So. I mean, I'm outvoted, so it doesn't matter. I'm hand back.
It's every program.
I think your perspective is important to hear,
Yeah.
and I think it's okay for us to disagree on this.
So am I hearing the left is what I'm hearing?
I think we're splitting hairs at this point. I do think that. I think the point of this is that we're going to have to make hard decisions for the community with limited resources and increasingly limited resources. So I feel like I'm fine with the left-hand column, but I think the conversation is really important. I think we're setting ourselves up for harder conversations to come.
And I think when we go over the tree, you'll see that this was only a portion of it,
Yeah.
to your point, to be able to expand on that equity side of it.
And then just think about the funding.
Yeah.
Right?
Because that's the harder
It's
discussion.
not feasible if we don't have the flexible funding.
It could be a high score. It could be a high score, but we don't have the sustainable funding.
All right, I hear some consensus at least. Let us, go back and make those adjustments. But in the meantime, I am gonna go on to the next. Patrick, if you can go on. So I do want to do a little bit of reflection on the scorecard, as I think Brooke, you were asking for it. So pass this along. This is actually, what I did is I gave a comparison of the mandatory and non-mandatory. I'm sorry, we need bigger paper.
You
Yes.
Yeah, I use my phone. I'm like an open, put the magnifying.
You know what it says.
Here, let's see if this one out. I just did a comparison and see if you can see that. Well, this is a little better, but this is individual, so this is your non-mandatory, and then I have a mandatory, so.
Okay, that's better.
Is that better at least? I just wanted to see.
You're not reading the.
Sorry, so.
They're the same, but one's a comparison. I'm gonna give you the other one.
This is both mandatory and mandatory.
And this is mandate, as you can see how they rank. I took the scores out just because. Yeah, look great.
But this is that question you all raised about, is it useful to kind of look at how the list turns out and to ground proof it and to say, does this still make sense? Or did we miss something important? Is there a pattern here that we should have seen that we're not seeing, or vice versa? Yeah.
So what I did there, this is based on the average. I only did Lexi and Endura. I didn't do the program or the division managers for this example, just because we've added, so this only has 58 programs with infrastructure, if you count infrastructure. And after going through this with the managers, we identified additional sub programs. And so we're about 80 programs that we are currently in our inventory. So that's why I wanted to kind of give you, I didn't give you the scores, but as you can see, green, yellow and red, and I ranked them. So if you can take a look at the programs, I think it's a good starting point to kind of assess, how are the rankings amongst the programs.
So Ramona, just to clarify, what does yellow mean?
Yellow, two.
You're just
Two.
It's a rage score.
So the cut point is.
It was 2.5. It was, it was 5, 4, and then yellow was 2, 3, and then 1, yeah.
And how are we even doing this for mandatory programs? Like, I don't understand.
This is actually really helpful, though, I think, to talk about.
Yeah.
So let me talk to you a little bit how it works with mandatory programs.
Okay.
I think it's important. So if you take a look at that, when you're going through priority-based budgeting, the scorecard gives us a lot of information. If you look at the mandatory, right, something that scores pretty low, is there opportunity for some type of lean improvement? Is there opportunity to look at? Yeah.
So, I mean, this is telling because you have epidemiology and immunizations as yellow based on your score.
And another thing is,
Hold on. I think Brooke's got a second part.
No, I'm gonna wait.
Okay.
so the other thing that I want to point out is it gives us the opportunity to look at programs because, so when you do priority-based budgeting, it has to be by step. So it goes from like best case scenario to worst case scenario. And so just because someone ranks low doesn't necessarily mean it goes away, right? You have to look at the lean. How can we make improvements? How can we move resources around? Should it be higher? I think, Brooke, you made a point about that program. Should it be higher? What do we need to do? Do we need to move money around and allocate a little bit more so we can rank it higher? That way it impacts the community a little bit higher.
Let me
Question.
give you a specific example of what Armando is talking about.
Am I in the front?
No, did you mention that it was not? This is not a ranked list.
No, but I'm just going by the scoring, so.
It's ranked on score.
It's grouped by score, but it's not ranked in order.
Yeah.
Yeah.
So for instance, if we had a program that we felt like should be scoring high and it weren't, it might be instructive to look at like, break it out, disaggregate, look at the criteria. Oh, it scored low because one of the lower scores was that it's not reaching enough of the population affected. And so part of what might go into the recommendations is to figure out ways to scale.
And I just want to say, this is just our first pass.
Yeah.
Right. We know that we have to go back, we have to rescore. And now with the changes that I know for those things, we have to rescore. And we need the division managers to be really actively engaged in that. And they were involved in the first round. So we just know that this is just a practice.
And we're missing 18. We identified 18 new programs that need to be added to this.
I want to do a time
And
check.
Daphne.
Yes, do a time check, please.
I'm concerned about the time because we're at 4:25. We want to talk about the reflections on the scorecard results. We want to go through the decision
I
tree.
think we're done with the scorecard reflections, I would say.
Are you good?
Yep.
I just want to make a quick little note that is extremely important, that these copies are shredded.
Yeah.
These are extremely confidential things and would panic staff if anybody saw these. So I just want to make that.
And they're not
These are not, yeah, this is preliminary. We're still missing 20, so.
I appreciate that.
I just want to make that. note.
Okay, so back to the time check, we need to talk about the recommendations and the funding matrix all before 5 o'clock. So we need to begin picking up the pace a little.
So keep that in mind. Like I said, now we'll make some changes. I think there'll be one more iteration with all these changes that we get feedback today. And I think those are the numbers that I use for running some of these statistics.
And that was a super helpful conversation.
Yes, I agree. It's super helpful.
All right, I'm gonna move on. So that's how we grade or we scored them, but I'm gonna move on to the next, which is the decision tree. And I think this is really kind of the third tool that's really gonna connect, or the second tool, and then the third tool will connect everything together.
Okay, so we've looked at our work across the agency and we put it into mandatory, non-mandatory, and infrastructure categories. We also know that part of the pre-work was that we had to figure out where we needed to break programs apart into sub-programs to be able to categorize them that way. Along with that, we part of the pre-work before the decision tree is to come up with clarity on to what degree is the program self-sufficient, either through some kind of reliable funding source. So we're looking for reliability here, and particularly for inflexible reliable funds that have to be committed to that work. And we'll talk more about why that is when we get to the funding matrix discussion in a little while. So we have that. And what we've done is we've kind of set up 3 stages in the decision tree. The first stage is really focused on identifying.
And they're in your binders, just in case, just if you need to look. What page is that on there? Page 22, if you look at the second tab, I believe.
So the first stage is really looking at program optimization and opportunities to increase efficiencies, to reduce costs,
Thanks, that just
maybe switch something from internal work to contract work, to enhance revenue. So for instance, if we have a fee-based program, is there a way that we could internalize the cost of that program effectively? So the reason that we have 3 stages is because we're trying to work just from principle, from a position of least disruption to our work, to recognizing that times are going to be challenging and we will likely get to the point of needing to look at reducing our services and possibly our programs. And so we want to start with kind of what are the efficiencies that we can gain. We don't want to end with the efficiencies, because if we end with the efficiencies, then we may have reduced more than we really needed to. So stage 1 is really about that optimization, program efficiencies and optimization. Stage 2 is focused on, are there opportunities for programs to restructure or to work with community partners in ways that reduce our costs? So we have programs that work a lot with, we have a lot of community partnerships. Are there opportunities for us to talk strategically with our community partners about, well, if you all can do all of this work, then we'll focus in on this work and it'll be a more efficient arrangement of resources. Or our funding limitations are not going to allow us to do this really important piece of work. Can you take that on? So that's an opportunity. The other piece of the stage 2 is, in terms of partnerships, is, are there opportunities for us to regionalize work? And this is a conversation that we're beginning to have in DPH and that I think we'll continue to have. It's something that we talk about periodically. For instance, if every county in the region is doing a mental and behavioral health communications campaign, are there efficiencies for us to do it regionally instead of every public health department doing their own? It comes up in relation to data management. It comes up in relation to a number of the infrastructure pieces, that regionalization question. But we're beginning to explore some other opportunities where it also comes out. So I think that that's a really important conversation for us to have. The third stage really kind of gets down to brass tacks. Are there service reductions that we could defensively make? Are there some programs that actually it makes the most sense to sunset them? And so we begin to see, especially things like the scorecard beginning to play a role back here in terms of guiding us to where we need to focus our energies. Now, we can lay out all of these recommendations in each of these three stages, and that doesn't mean that we have the answer yet, because we have to go through, well, first of all, we have to make sure that the recommendations that we're putting forth are aligned with the recommendations for infrastructure. So even though infrastructure did their own kind of internal piece, right? So the budget team and the contracts team and the communications team did their own program recommendations according to these three stages. We also need to look at our overall infrastructure needs based on these recommendations, because it may be that we don't need teams as big as we used to. And so we want to do that kind of reconciliation back here, as well as look at whether a higher agency level restructuring would be important this year. So that's an additional opportunity for savings, for budget savings, that helps us to align our workforce and our structure with what we're actually going to be putting forth as recommendations. And then the last piece is really feasibility testing. And it's looks like this really simple box with 2 words in it. And it's actually quite complex, because it involves being able to reconcile the recommendations with the funding matrix. Is it feasible to move our flexible funding in the ways that we're proposing? Have we achieved the budget targets for each of the programs? Is there additional work that needs to be done there? And have we put forth enough recommendations to achieve each of the scenarios? And we'll talk about that a little bit more in a minute. We also, in this feasibility testing, need to give some consideration to unintended consequences for our partners. It may be that stopping a particular service has a huge impact on a partner that depends on us to do that service for them to do their work. There may be communication needs to the community about why we're standing down services or programs. So this feasibility testing really helps us to get to what's realistically possible, and what are those final recommendations that go into the implementation plan that allow us to demonstrate that we would be able to achieve each of the 3 scenarios that we've laid out that we'll talk about. Did I miss anything?
Got it.
All right.
So decision tree is very important. Patrick, can you go to the next one? Yep. So obviously running through these programs would run these, and I just want to give you an example of what it looks like. So stage 1, Armando's baseball lessons again, right? So currently I'm doing them 4 days a week. So I run it through stage 1, the cost for the program. So another thing that we've done, just to give you a little bit of the background, is the finance team has broke down every single program that we identified in the inventory and gave it a monetary value. We've worked with the programs, division managers, and so we can actually identify every single program that we offer.
What their cost.
To what the cost is. And then we're also looking at the revenue coming in, the sources. So for my program, it cost me $100,000 to run. I run this through the first stage. We give them a target. Target is I really need to trim it by 50%, right? So my recommendation would be is we reduce the rent, or we reduce field rentals to 2 days a week, but I still provide the same lessons. So service level is still the same, but I'm only needing the field now twice a week. And so instead of 4 times, so the savings would be 50,000. Okay. Now I move it on to stage 2. Stage 2 now is I still need another additional 25,000 in savings. And so what I ended up doing is I ended up calling the YMCA, and they'll partner the second day. So they're not only am I doing the first day, they're doing the second day. So I'm saving another $25,000. Right? But still, it's not enough based on revenues coming in. they come to me, and they're like, hey, unfortunately, we run it through stage 3. And my recommendation would be the plan would be to sunset the program. YMCA decided that they're going to take it over. And so the total savings would be 100,000. So if you look at the max saving that we can ultimately do, it'd be 100,000. You would see this for every single program. And you can also look at the bottom would be a savings by stage. We'd like to get all the programs through these stages so we can actually start moving slowly by stage 1 to 2 to 3, depending on where we need to be as we continue to look at the trends that we're getting as we look at our financials. That would really help us determine, how far do we need to go within each stage.
I want to know who's involved in this discussion.
So who's involved? Actually, it's a little bit of everybody, right? But it really is the program manager should be developing these recommendations with us giving them targets. We'll talk about 3 scenarios today that we're predicting. So those would probably be the starting point for them to start looking at these recommendations and providing, their feedback and ultimately bringing it back to the director's team and then ultimately making final decisions that would lie on Lexi and the director's team.
So the beauty of the recommendations sheet is it kind of gives everybody an opportunity to put everything on the table. And then for us to look comparatively through the programs and say, what's the smartest decision for each program? What do we end up with? Does that allow us to achieve budget goals?
Good questions on that as we develop this? That's the decision tree. A lot of information on the decision tree. It's going to take a lot of work, but ultimately, I believe it'll give us a good understanding of total costs needed to run the safety. Next one, please. And so the final tool that I want to talk about is the funding metric.
I'm sorry, clarify one thing. So when you're asking to do this, are you giving them targets based on scenarios to say is it a consistent target? Like, how are you?
Yes.
Yeah.
So right now, we're going to go over some scenarios. I can tell you that we need to have a worst case, a middle scenario, and a status quo, say everything goes back to normal, everything coming in. Those are the kind of the scenario, the priming that we'd provide them.
But I think I understand where you're coming from on this question. Lindy, tell me if this answers your question. So when we say, for instance, the scenarios, reduced budget 10%, 25%, 35%, it doesn't work for us to set that as a target savings for each program because the programs are not the same.
Mm-hmm.
Those have to be targets for the overall savings.
Yeah.
And so by having the program coordinators work with division managers to propose recommendations and to look at it holistically, then we're actually making a much more strategic choice about where we're investing money and where we feel like we could afford to maybe reduce services or have some other kinds of interventions that'll be most closely matched with things like, is this a high priority program? Are there opportunities for lean changes that actually make a significant difference and be much more kind of tailored to the kinds of recommendations that we're coming up with while still being accountable for the overall budget reductions outlined in the scenario.
I would say
Okay.
if we had a budget that had the same funding source.
Yeah.
It'd be easy to do.
But we don't have a
Yeah, you
budget.
have to factor all of that in.
Yeah.
Right. But so you're not giving a specific target, it sounds like then. You're asking them for a number.
The savings target will be, I think I said that, let me say it again because it's
Yeah.
confusing.
Yeah.
The savings target, the original number that we'll put in that box has to do with what would it take for this program to be self-sufficient. The expectation is not necessarily that every program can achieve that. We know that's not realistic, but we're going to give them a target to shoot for.
Okay.
So, okay.
I acknowledge also that you guys went through this in the last year, right? I mean, we did tighten up
Yep.
quite a bit already, so
So we
this
did
is,
tighten up quite a bit.
yeah, challenging.
We did it last year with the operating.
Yeah.
We cut a lot of operating,
Yeah.
cut our trainings, put a hiring freeze in place.
So I want to acknowledge for our staff, we understand that there was already a lot of tightening up that has gone on.
And this, and then just a reminder, this is for the 26th budget.
Right.
So this is going to create an opportunity for us to go through this every year so we can get better and better at it. And it'll be so much easier next year. Yeah, so much easier.
We'll see.
I must feel it in the room.
So I want to talk about the funding metrics, and this is, I think, is very important. As we run it through the decision tree, start looking at recommendations and then feasibility. This is important as these are actual numbers based on the 80 programs that we looked at. And right now we have it broken down by programs, but for the funding metrics, we really broke it down into these four categories. And then also the categories that each program fits in. So federal, perceived, reliable. One thing that I want to disclose within this number here, we have about 5.5 federal grants and pass-throughs right now, but I moved them down to unreliable right now, just because of the current environment that we're in. So keep that in mind.
About 1.8 of it is probably reliable. On that first line of our federal funding, about 1.8 million of it is reliable.
But the other four is about 4 here.
Most of it is probably.
In a normal, I would have
And this
put it up
is
here.
25.
So this merges all funding sources. So this is grants, fees.
Everything. Yeah, so if you add those two together, that's our budget, as you can see. That's my controller, right? It's 2.4. That's what we have as a budget. So this is what we'll be using. This really kind of gives us a good idea that, for example, unreliable right now is we have about 7 million. And that's just due to the environment. There's a lot of things that go into that we need to look at each individual program. But those programs under non-mandatory, 7.3 million. If you look at reliable, non-flexible, mandatory at 4.1. That's usually your fees, right? They're structured. They can only be used towards a specific program. We have a couple grants that fall into that category that specifically can only be used for that type of program that they're funding. Then you have your non-mandatory, and then you have your flexible, reliable flexible, which is, for example, that's most of your county money coming in. It's a lot more flexible. We can do a lot more with it. Yep, your per capita. So as you can see, some of the county money that we do have is like for mosquito, things like that. But overall, about 8.8 is flexible. Really, that's the line that we really need to look at once we assess, scorecard. If there's programs that don't have any funding, this is what's important for us to see. Is it feasible to be able to fund a program that maybe doesn't have any funding coming in, but is very important to the community? Those are the things that we need to look at and to be able to assess and move things around. As you can see under infrastructure, 5.9. That number probably will adjust it, next year if we do some reorging. So those are the things that we need to take in consideration. So this is very important to look at. But the majority of our funding right now is under non-mandatory, and it's 46%.
Where's the majority of the grant funding falling in here? Is that reliable, non-flexible?
I moved it to a lot of it there.
It depends. Some of the grant funding is still reliable.
There's a couple in. Yeah, there's a couple in there, but I would say right now, because I have 5.5 million, and that's being conservative, through pass through and federal, the bigger chunk is in there. And so really helpful as we progress through these tools to be able to determine what is feasible, what isn't, where can we move things around. Questions?
I was just gonna make a comment. Armando, would you say that the infrastructure, the 24% represents really the indirect and some of the?
That has some effect to it. But a lot of it is the county, right? Prior to me being here, the way we did some of the personnel was slightly different. So obviously, some of it was all in personnel for, making sure that we had personnel salaries in the county. So as we do that, we're assessing everything. As you recall in our budget, we're running about 81% is personnel versus that other percent is operational. So there's not a lot of room in the operational, and it's really looking at the personnel.
So that's why we also incorporate questions like, is there an opportunity to move services into a contract?
Yeah.
That can help us rebalance some of that personnel operational imbalance that we have.
I mean, the question that comes up for me too is if I think about what are we mandated to do? And what we know is that most of those mandated services are not actually they're not self-sufficient. Yeah, so then, given cuts, would we have to move funding into mandatory to cover the mandatory
It's a question.
requirements, right?
And I think this also goes to Lindy's point earlier about benchmarking with other counties.
Yes.
Because like, what is the service level that other counties are proposing to provide for mandated work? Because I think as long as we're in alignment with them, I think that we're being responsible stewards, doing the best that we can with the money that we have, working towards internalization of costs. And we want to be attentive to those benchmarks because we don't want to be too far out of line.
Lexi, are you, relative to the conversations going on about how to share resources and programming across counties, is in some of the infrastructural parts of this also part of that conversation? Like how to get those economies of scale potentially?
So the communications example I gave you,
Yeah.
or the data example I gave you,
Yeah, great. Yeah, sorry.
That's okay.
Said that. Had connected that was a new structure.
Yeah.
Questions? Okay, we're moving along perfectly. So let's move on. One thing I want to talk a little bit about. Yeah, so we have about 15 minutes, but I would love to hear some feedback, take some notes as far as the tools, concerns, even if you have any ideas, anything that we're missing that you feel that we can add. But obviously, I'd like to get some feedback on the tools as now that you've kind of seen every single tool that we're using for priority-based budgeting, and ultimately before we implement implement a plan.
In on each of these categories. Like we obviously now have an opportunity to weigh in, we talk about program managers, but like along this course.
So-
what are the?
Yes. So with the scorecard, originally, we first started with directors because we were kind of playing with it. But now we expanded out to our division managers. They're the subject experts. So they're going to be actually scoring the card with Lexi and Endura. We felt that was probably the best way to really get a grasp or a good scorecard. From there, the decision tree is actually going to move down to the division managers to have the opportunity to kind of set up the first initial recommendations. And then ultimately going to the directors team, we'll refine that. Maybe we might have to go back and forth a little bit, some dialogue, collaborative effort between the groups. I would even say within the decision tree, if I was a division manager, I'd probably bring in some of my supervisors because they're out in the field and they can probably provide a lot better information to make recommendations, depending on how far you want to go, stage 1, 2, or 3. But definitely that first stage, I would say, I would definitely go with those that are out in the field doing the work. And then,
So I
You
would
wanna
just
add
say, yeah, I would say we're trying to anchor the work in the management team, recognizing that division managers will need to do consultation with their teams to pull information back into the tools. And also that the funding is the funding. That is a very kind of concrete, objective component of decision-making. And also recognizing that there will be some spaces where division managers feel very comfortable saying, we're good to do this. And there may be other spaces where division managers are not comfortable. They put a recommendation down or maybe directors have added a possible potential recommendation. They're not comfortable making a decision. And we know that a decision, the decisions are going to have to be made about how do we achieve these scenarios. And then we kind of will wait to hear what the real scenario result is based on the funding projections coming in. And then we may have to help make some decisions from the directors.
Sorry, before I think the question about transparency is really important given what's going on nationally right now, right? How little information to people who are being impacted by cuts. And so how much is staff aware of the process?
so
Yeah, and then ultimately, how much transparency is there for the public if
than when our decisions made. So that's really important. I just have a couple comments. We did put together a 2-pager, 3-pager now. I don't know if it got sent out today. John finalized it. It'll get sent out tonight. So we do, because it lays out the whole process. And it also explains the why.
Mhm.
So
For staff. And
For
this is not the first
The
time.
communication
we've heard
plan.
about this,
yeah.
But this is probably the most in-depth, detailed amount of information.
And it also, to your point, it does say who is involved at each step of the process. The second thing I wanted to share is that when we did priority-based budgeting years ago with Jeff, that team did not want to make, that director's team did not want to make decisions. And so we put the whole agency through a process, and they wanted the decisions to be made at the division manager level, and nobody made decisions to cut. And that was not a fruitful exercise. So there is this need to be consultative and to have people informed and to be transparent, but also a need to, somebody has to make the decision.
We understand.
Yeah, so it's a kind of a, we want to be transparent, we want to be clear, but at the end of the day, I do think it's going to be the director's team that's going to finalize all the recommendations.
Yeah, so
And the good thing is it's for the 26 budget. So there is time for us to work through it too.
Couple of whole months.
yeah, I would say a couple whole months, but I'm gonna add a little bit. I'm gonna add a little bit to the mix, but ultimately the funding metrics obviously very transparent. I think with the managers, division managers ourselves, but to Endura's point, ultimately really is going to come down to the director's team to make those difficult decisions. The only thing I would say is we are working on a communication plan. So today the first one went out, but I think communication plan, communicate is part of the change management. We got to constantly communicate. That's going to be the biggest thing. Tomorrow we have a retreat with supervisors and we'll be going over it again. Eventually all staff, the communication will go to everybody, but I think it's, really giving them the why we're doing this ultimately is important.
And I think staff are aware, they're feeling their federal funders are not coming through on their, operating plans. So,
And I'll say, folks have been great so far. Recognizing that we can start making adjustments to what we thought was our budget. And maybe saying, maybe we're not gonna spend so much here. And kind of being able to generate some pretty quick consensus around some of those items. So I feel like our management team is in a good place in terms of recognizes can take everybody working at this.
I appreciate the language that you all keep using about consolidating and finding efficiencies versus cutting, right? Like, I do think how we package this matters. Yeah.
Any other suggestions in regards to the tools or concerns? We have a little bit of time and the food's not here, so I'm gonna.
wow, let's keep going.
So yeah, let's press on.
Yes.
I agree.
In Sunday.
I might just have to stay.
That's why we're.
That's all.
Great conversation with priority-based budgeting. Really appreciate the information. We'll put that together and continue developing. So the next part that we're gonna talk about, where's he at? Hit the. Is dinner will be here, so we'll continue going. But I do want to talk a little bit, what we're facing right now is this funding deficit and uncertainty, and it's important to acknowledge the challenges that we're against. And within these tough times, I think it's important that, we're adaptive, flexible. And so with that said, through resilience and collaboration, we are finding creative solutions to maximize resources available to us. And together we can continue delivering essential services and ultimately emerge from this, I call it the storm, where we got to weather this storm. And so the next couple slides, I'm really going to talk about where we're at currently. I think that was something that the board was asking for, but I am going to give you some quick disclosures. So very preliminary because I only have 2 months that I actually have actuals for. You did receive the monthly report. You'll get another one coming up here on the 15th, but I'm going to talk a little bit about that. And then I ran some statistics on that and some trends and some analysis as far as like how am I getting some of these numbers. So I'm going to go ahead and just jump right into it, and then we'll get to these scenarios. So I always kind of start with just kind of historical. I provided it for y'all. I provided 22, 23, which we've been audited, and currently we're working on the 24 audited. So we still have it as projected. I still see it coming in pretty high. We'll add some fund balance. And when I say that is, it takes us a couple months to close out the year. By June, you'll have our audit completed, and then we'll have some deficit fund balance numbers. But right now, we're still looking like I projected here in December, about 8 to 10 million in fund balance. Depending where it comes in, we're still booking a lot of the funding.
How much of that would be new fund balance?
We had 7.1, so from anywhere from 1 to 3 million is where we're going to be adding. Okay. So it just depends when we close out. But I'm going to add some more to that. So that's how we're ending. But the first 2 months, we didn't collect enough revenue coming in, so I pulled from fund balance, right? So I'll talk a little bit about that and how sustainable is that long term. So with that said, 25 budget, I thought we have a pretty clean budget. Obviously, there's always room for improvement as we continue growing. 24 million was our original adopted budget that y'all adopted. And with that, you can see the progression. I'll talk a little bit about, we did incremental budgeting prior for my start. And I think prior before that, that's kind of what we've been doing here. At this agency, we went to a base budget that y'all approved. We worked with all departments and, we provided some vehicles for them to be comfortable and really provide services without hurting service levels. And so I'm comfortable with the 25 budget. And with that said, though, unfortunately, because of unforeseen circumstances, we have a new administration, and it really has impacted our revenue coming in. And so with that said, I don't know if our 25 base budget is accurate, and we might have to rebase it. So that's kind of to Endura's point, is not only are we working on a 26 priority-based budget, I think we're going to have to rebase the 25 budget.
Hey, Amanda, where does that show up? Because, when you look at the lines, you're like, federal funding is it's less than $1 million. It's recorded for the 25 budget. So where are the other places that the federal money is being counted on those lines?
So we have a lot. For example, we have federal funding. You have state funding. A lot of the state funding is passed through. So it's coming from the feds to the state.
Yeah.
If you can see that's 7 million of it. Later on the slide, I do have a list of all the grants for you.
Yeah, I saw that.
You saw that? So that adds the 5.5 million. Okay. So we even have some that are coming from our county. If you look at the county Boulder one, that is ARPA. That's going to sunset. So keep in mind, some of this, that 5.8 million that I'm going to be discussing, some of it is because it's coming to its end, right? But some of it is expected, but we still have to account for that when we're budgeting. And then we have a lot of it that is still held up with all this legal stuff that's going on with administration. So just I want to be very careful that we're going to have to rebase 25. So not only are we working on a 26, I think right around the same time we come in, we're going to have to rebase 25. And with that said, is not only are we going to expedite priority-based budgeting, because I think it's a good method to use, because it's really using data-driven decisions to really rebase 25 and hopefully start a good 26 budget. So I'll go a little bit over the last 2 months. So just to give you some perspective.
Can we go to the next slide? Okay.
Not yet. Let me talk about this one, and I'll get to the next slide. So just some perspective. Over the last 2 months, and I'm going to talk about it on the next slide, but just for if you read your monthly report, we should be averaging about 2 million every month in revenue. Keep in mind that doesn't always happen because of the type of revenues that we have. So there's always some timing issue, but for the most part, I took an average and we come in about 1.8, right? If we look at the last 2 years, we're about averaging about 1.8. Based on our budget, we should be about 2 million. For January, we came in about 800,000. So
Move to the next slide, because I think it's on the next slide.
no, because next slide I'm going to talk about how much we got.
Patience. I was on
The slides for Mondays.
That's a lot of pressure.
I will get to the percentages, but I do want to just talk about, we were unfavorable 1.2 million for January. The next slide goes into February, so that's why I want to kind of talk a little bit about January. One thing that I would say is, I know our budget, I think we did a pretty good job adopting a good base budget, is because our expenditures came in favorable $8,000, which means what we said we are going to spend, they spent. That's good. We want to be within 2% in our budget. It's there. And that's, there's always timing, but I think that was a good indicator that at least we had a good adopted budget without knowing what was going to happen at the beginning of 25. So with that said, I am going to go to the second slide, or the next slide. So I gave you a little bit more projection. So what I ended up doing is I only gave you partial of PH11. And the reason why I looked at PH11, it really talks about our grant funding, pass-throughs, things that we really have no control. That's a little bit unreliable right now. And so that's what I really looked at. I didn't look at the county because it's reliable. It's coming in. We're set. I haven't talked anything about rebasing budgets. From my talks with the county, we're going to get the money that they promised. So I really want to focus on the PH11, which is our funding, our grant funding. And that's passed through different types, private, all that. Just between January and February, we only received 60% of it. And so to me, that is alerting. So that means in January, we got 45% of that. And then in February, we get 72% of that. Average that at 60%. I did a full year based on just 2 months. Keep that in mind. I'm being careful with 2 months. I got to disclose that. I anticipate about $6 to $7 million deficit if we go out of December. If that continues, keep that in mind. If that continues, that's 2 months.
And do you give context about it's happening all over?
Yeah.
This,
Yeah. So we're not the only. I have we have constituents in other places, the state, other local government that have programs that rely on funding or grant funding, and everybody's in the same boat. I'm kind of surprised that we received as much from what I've heard from other constituents, so I'm happy about that. I just want to make sure that we continue getting more. So right now we're assessing those individually to see what's coming in, what's not coming in. It's just all over right now. There's really no way for me to say it's going to be consistent or not. So that's why, as you recall in the funding metrics, I moved that down to unreliable. I can't depend on it. We'll continue working, but it is affecting our fund balance. And so I want to make that clear that 1.2 that these last 2 months that we went in the hole, that comes out of our fund balance. It comes back. We'll get more coming in, and we'll continue grow it, and we'll deplete it. But we have to keep looking at that constantly on a monthly basis to make sure that we're sustainable for the remainder of the year.
Armando, this is going to sound like a tone deaf question, but I'm going to ask it because I really want to make sure I understand, which is, do we not actually know these programs have been cut and at what amount? Are we guessing?
What do you mean programs have been cut?
I mean, you're going to you're trying to figure out, is this going to continue? How much is it going to be? Why don't we know that is my question.
Nobody knows that. There's no communication.
Precedent.
No, I understand.
I think there's nuance within that 5 million, right? Because there are some that it's just delayed because of administrative changes, and there's some that are at risk of being cut. I think
We're hearing about now we have to reimburse. They're building a new form.
there was a court case on February 4th that got, because they stopped paying people.
Yeah.
And then the court said, no, you have to pay people because this is.
But we're still not getting some of that funding. Keep that in mind.
So there might be delays to.
I know from back in the day, public departments, that often there is a delay and there's an administration shift, right? So how much more drastic of a delay is this than normal?
A lot. Like I said, we should probably.
We don't know.
And it's happening widespread.
Yeah. So
We do know a little bit. We are getting some feedback from some of the departments that we've gotten some information from CDPHE. Some of the grants have received specific instruction on what they can and not spend money on. So we are getting some amounts. Some people have their contact people, they're not responding right now where they were previously. So we have a wide variety of different reactions and levels of contact that or communication that we're getting.
And which grants
Yeah.
are not getting funded.
Yeah, we're tracking all of this information, but it's a little bit all over the place. It's not consistent. And it's hard to set expectations based on what we've seen so far.
and so that's the reason why I hate to add more to, you know, 26. Not only are we addressing the 26 with priority-based budgeting, now we have to address 25. And I believe it's gonna be, it has to be a rebase. So,
But can you restate the number that if we're running at this run rate right now, what the miss would be?
6 to 7 million. Keep in mind, I just want to be clear, that's only 2 months, because within 2 months,
It's the first 2 months of administration.
there's some, some changes, so
Sure. Yeah.
we have to be careful about that, right? But I think, but we still have to continue monitoring it and start making this, that's why we have we don't have a lot of time, but we still, I'd be more comfortable as first month or first quarter to be able to say, are we starting to get some more, funding in?
And we're still doing audit adjustments on these numbers, so that is starting to affect that
Yeah.
number as well for the revenue, because we have to move our revenue account. Period of the sport. So we're starting to see some of those adjustments come into play.
Amber. And to deviate a little bit, I know Armando, you said that we should be passing a budget amendment by May, right?
Yeah.
So, yeah, you're reading my slides here.
Oh,
No, but
I looked for it and I
So-
didn't. That's why I was-
So with that said, that's kind of the blue portion, right? That source and use, we have a 25, but we're trying to get a 26. We're gonna have to add a middle column and it's gonna be the rebase of a 25, and that's when the amendment would come in. It's early, but that would at least give me an idea to be a little bit conservative to say, you know, are we getting only 20% of these certain amount of grants? Let's adjust, because we can always adjust against it at the end of the year. The problem is we have to adjust operations. And so that's where we need to start looking at priority-based budgeting. We're gonna have to start implementing some plans, maybe more on the stage 1, and then continue, you know, progressing to 2, 3.
I do have a question.
Yes.
It's not here to go back to the last one.
She's right there.
Thanks, Sarah. She has permission and control. On this one, it looks like for the first time in a few years, you're expecting that fee funding is actually going to increase, but is some of that dependent upon changes in Medicaid?
So that was pretty,
No.
Not that.
not Medicaid, but other fees that we anticipated are gonna come in higher, but that might all have an impact also. For example, tobacco, we heard that the state, we're gonna get a decline in tobacco fees. So everything does have an impact, so
But
keep that
that's
in mind.
not a fee-funded program. That's
Correct.
I think it probably represents the increase in the OWTS
and the restaurant
and
inspection.
restaurant.
We had a couple in there. Yeah.
Yeah, I would say.
But this was prior
Yeah.
to what we started in 25, what we anticipated. I think the programs, you know,
This is only OWTS.
is it all, okay, there you go.
Right. Restaurant fees have not been enacted, so it's
Okay.
not contemplated in the
Yeah.
2025
It'll
budget.
show up in the 26th. budget.
Yeah.
Potentially the
If
budget
it passes.
amendment, if it passes and when it's effective.
Yeah.
But it will have an impact. So that was 25. Now we're kind of in a new 25.
And we have, I don't know how much we get in Medicaid revenue, and Desiree and I had started this whole Medicaid, and now we're like, well, we don't know if that is gonna happen because we don't know what's gonna happen. with Medicaid. So it's
So
very,
there's kind of two components to Medicaid. One, so CalFO is actually working with CDPHE to set up a Medicaid billing system for LPHAs because Colorado, for some reason, doesn't bill, LPHAs don't bill Medicaid, like at a rate that's like we're at the bottom of the 50 states. It's like, why don't we do this? So they're going to set up a system for us. It's just billing of existing Medicaid costs. There is also going to be a community health worker addition to Medicaid at the state level that was supposed to go into effect in July. I doubt it's going to be adopted at this point, but we can still bill Medicaid in the spaces where it has already been established. We are just providers who have not been doing that, along with most other LPHAs across the state.
And that would be displayed under fees, or that's a different column?
No, that's a different column.
Medicaid revenue is not that great in this agency, but it has the opportunity depending on what happens.
And we didn't necessarily project Medicaid revenue starting in 25 for our 25 budget,
Correct.
right?
You know, we
We
did.
projected them in 26.
I do think it's really important, especially as we are not seeing, or we're seeing the impact of federal grants not coming through and the adjustments we're having to make either to our own internal money movement or our operations. Be sure that we're regularly communicating this with our representatives
Yes.
in Congress. 'cause they
Yes.
need to
In
know.
fact, I met with Kyle today.
Yeah.
I mean, So there's state level.
Yeah, the
And
state,
then
but
there's
then
national.
yeah,
I met with Kyle Brown today, told him why we need him to hold the line at the state level.
yeah,
We actually have several communications in development for Senators Bennett and
Yeah.
Hickenlooper.
good. And
And Representative
Yeah.
Magoo's
Yeah.
on 3 different topics related to the impact of the federal funding.
Yeah, just because they need to, Congress needs to
Yeah.
be. Needing that too.
And we would actually like Board of Health support for those letters.
Thank you for remembering that.
So, go to the next slide, just to finish off. So, one thing I just want to be clear is the key factors contributing to this shortfall is I want to be careful is, grant cycle timing, right? Timing is usually the beginning of the year within any type of grant. So that is contributing to that delay, and then also the delay in funding. So that is something new that we don't see based on them holding up the funding. And then ultimately, all this legal action that is going through, holding up some of this funding. So we'll continue assessing that, but it's very unpredictable right now. So there's a lot of uncertainty, but we'll continue monitoring. You'll be receiving your monthly reports. But the biggest thing that I want you to take away is not only are we trying to do it 26, we're going to have to rebase 25.
You guys have been through a lot.
So I want to talk a little bit about the federal funding since it was brought up. In your packet, you do have a list of the 26 federal grants and pass-throughs that we currently are monitoring for 25. All I did is I put the funder, for this slide, but there's 26. You can see the amount, or at least the percentage. But within that, there's 5.5 million that is outstanding. Some of these grants they're supposed to sunset, so we knew that. So we need to address those as we continue building this budget. Others are not coming in. Others are maybe a timing issue. So we will continue monitoring. The other newest thing that we're also hearing is they're making some changes to how we submit reimbursement. And we heard that they might be adding additional fields. So we're concerned, what are they going to be asking for? Is that a workaround going from the legal into more of, the operational? And so are they going to be denying funding? So that's what we're looking at. This is all assumption until we actually see the forms coming in.
Do you want to talk, the reimbursement will be tied to the executive orders that the president.
Correct. That's what we're hearing, but we haven't seen it.
CI executive orders, the Defense of Women executive order.
Radiology. Yeah, so that's what we're hearing, but we haven't seen the form. They're supposed to be developing it. We'll see what that looks like. We've heard that that's kind of a way to do the back end channel of denying funding, but we don't know. That's all an assumption. So I want to be careful when I say that. We just got to monitor it.
I hope CDCHE is giving direction to LPHAs on how they can adjust if they want to continue to receive funding. It's like CDCHE should be providing that.
I think they're providing it insofar as they have
Yeah,
information.
right.
I think the challenge with CDPHE is that every division has their own contracting
Uh-huh.
system. So we get contracts from CDPHE, but they're not uniform.
Yeah.
They're all very different,
Right.
have different regulations. So I think
Different funders, different departments, so keep that in mind.
the CDPHE may not be as organized and ready for this, but we're going to have to respond to it to make sure we're compliant.
So again, I keep on repeating myself, but the federal funding at risk really, I want to hone down to it's 25% of our budget right now. And that does not only just include federal funding that is at risk that because of the new administration, but also stuff that's going to sunset. So just keep that in mind. The big certainty is really adopting the federal budget in March 14th, because that might have the opportunity for them to make some of the changes based on contracts and agreements that we have within these grants, is what we're hearing. But we're monitoring, we're working. There's a lot of assumptions. People start telling stories, but we just got to continue monitoring.
It's the budget.
Yeah, if they pass the budget.
6 months.
Yeah, so that's one of the things. And then obviously, I think it's slowing down. I'm hoping that it's just slowing down the reimbursement of some of these, and hopefully we start seeing these in first quarter, towards second quarter. But yeah, I can't say it's going to happen until we actually start looking, at the funding coming in. Next one. Talk a little bit about the state. Sarah's been really kind of following the state. She has the background with the state, but right now the state just updated it. So they're having it was a $1 billion shortfall for 25 and for 25, 26, and projected to exhaust their reserve on for the year 29, 30. So that's important. The reason why I say that is it does affect some of our funding per capita, the the tobacco, and then the Family Connects. So we'll continue, evaluating. We are already got some information as far as some of the smaller cuts, but they're not final. So we'll keep watching, the percentage reduction on those.
It'd be super helpful on this federally funded pass-through matrix is to understand, because there seems to be some color coding, but
It's by
by
division.
division, yeah. So it would be helpful to know like what are most at risk funding sources.
And we're gonna have a meeting to go
Yeah.
through it, because some of them we were expecting.
Yeah, exactly.
Like the
And some are probably less at risk than
And I
others.
thought I put the date when they end. So those that have end dates, that those are sunsetting. It's really the ones that were open throughout the full year that we need to identify.
I mean, the big questions are like, are they gonna keep funding the Vaccines for Children program, which funds immunizations? Are they gonna keep funding emergency preparedness at the same level? Are they gonna keep funding some of the antibiotic resistance work that we look at?
Yeah.
Or, and so we're gonna have a meeting to kind of go through.
WIC.
What's that?
WIC.
So the
When-
$1 billion state shortfall, what does that include? Shortfall due to.
I'm gonna defer to Sarah because she's been following it with her.
So I'll explain this. So there's that 1 billion is based on current law, right? So if they don't make any changes to current law to Medicaid eligibility or what, they have to account for 580 million because of funding or costs that they moved to ARPA. And that's largely personnel related within the Department of Corrections and Services and Judicial. So that's what did I say?
So ARPA, which they knew was going away.
Yeah.
That was been sunset, yeah. And then Medicaid is another, yeah.
Right, and this is before we even get to Medicaid. And then they've got $130 million of changes that they made to the current budget, the 24-25 budget. I'm sorry, it was 84 million, but then it becomes 2 times that for 160 million in 25-26 because it's a full year of cost. And then on top of that, Medicaid caseload is another 335 million, just changes based on current law, and that's how you get to the $1 billion.
And didn't we also pass a 350 million towards police training, right? Is that another big?
I
Yes.
didn't see that in the
Yes.
memo, because I think that's part of
It
what we just
requires-
passed us. That's
Yeah.
right.
As voters, so that'll go.
Yeah, it requires them to put money
Yeah.
into that.
So that would be within the current law
Yeah.
pieces.
Yeah.
Although they do have to enact legislation, as I understand it, on how that's implemented, but I would, my working assumption is that they put that as a marker in the budget, to your point, to say that that cannot be touched because it has to go to.
That's your mark.
Yeah, they have 2 other scenarios, but that's the current law scenario.
I mean, we as a state overspent on Medicaid last year, right? I mean, isn't that one of the biggest?
Yes, but it's increased expenses, not necessarily expansion of
Service.
numbers of people, right? I mean, I think it was increased expense, right?
Increases and other things that are going into that.
Okay.
And that's only 10% of the overall Medicaid expenses for the state of Colorado, which is where we get into a very serious situation if the feds decide to not cover 90%. Yeah.
That's right.
Any other questions?
Cocktail.
Yeah. We have dinner, so how about we break for dinner?
Not good enough on it.
Everybody, your names are on your meals out there. Every sandwich gets an Asian.
Every sandwich gets a chip. Everything for every sandwich.
Sounds like a Dickens.
Are you feeling it in healthcare yet? Are you?
I think it's a lot of beer,
The grand.
It's the unknown.
It's not like it at all. And
No.
So we had that last healthcare.
So we have 30 minutes scheduled for dinner. Do we want to take it all or do we want to take part of it? Work with dinner?
I would prefer to pass it. Late night.
Yeah, no, and okay, why don't we start again at 5:30?
Let's make it least.
Now, say it, collect.
Yeah.
I know. Well, I was just curious, even that the hospital.
Oh, yeah, I mean.
For there, it's just social time.
Yeah.
I saw positive report
Yeah.
and started again.
I mean.
That way we're not.
You're doing so good, Armando.
Just remind, just remind everybody that they're reporting, just gonna make a reminder.
Did you let them know that we'll be back?
Yeah, 5:30. They want to start again at 5:30.
Okay, perfect.
Not.
Yeah. Yeah.
Oh, sorry, national guard.
He's like, I want to stay.
I have.
When you say about positions, you're just talking about for. For her, it's all. Because I know in the past, colleagues wasn't.
I'm the honor of that.
Nice to hear.
Which is. If we can, like, can. Last time. Exactly, yeah. It's,
You can just monitor if you hear anything really bad.
Thanks for dinner.
It's like, what should I read about like,
They have one, but I guess.
Yeah.
Oh, yeah, well, that's legal, that's filed, but I don't know if it's allowed. Yeah.
Sounds like. Are you traveling?
I
Somebody.
am not traveling a lot, until July. June.
Okay.
There's enough. Good. So there's just, there's spring break. Which. Right?
That's, I got mine over here.
Yeah, I didn't.
None of them are vacation. I don't know. I said, Monday, if you're. Is it Monday? Grabbing
Yeah. Oh,
boy. Tell you, I mean, I can.
all the.
Usually is one sister will show up, random, she'll get in a horrible fight with everyone. Yeah.
I really did think that.
Yeah, yep. Yeah.
It's good to have expectations.
I mean, it's 10 years. So every single that's.
Everybody gets a bit.
That's.
I'm gonna eat. So now. And I went to camp. Here too. The people were. I was like, oh, I'm going to have meditation. I'm gonna have job. You know, water, like. I feel like. It was like, not the Bible. You know. They are, right? Yes, restaurants, sit and relax. It's known to be like.
Relaxing and meditative.
And that's what Daryl said.
Not much vibe about.
Hey, Daryl, you would.
Spring break, that's right there in college. Never, ever go back there again.
People do go.
Yeah. So lucky I didn't pick up that day and the film party. It's disgusting. So gross. Opportunity lost.
Yeah, darn it.
Darn it.
Great, right, so.
I'm putting out my predictions to my family. And I.
At least you can talk to your family about it.
How many kids? How many kids is this? It's just 3 kids, but,
Well, if you count the adults that are toasters, I mean.
well, then that's all, that's a lot of kids. So, I don't know. You're going to a resort again?
Yeah.
This is.
Yeah, I don't know.
And I don't think, I don't even want to sit on the bus fast. For that hour.
Yeah, you muted.
I remind. I'm gonna ask. I'm gonna ask somebody to get my face.
There's out.
I'll ask-
On its own. Oh, where did it go? Where's the antique?
Just a reminder, it's actually recording.
Right up her nose.
We're still talking about Astrid singing of her note.
Yeah, so she did it Tuesday. Oh, it went up the nose. Spent all day on Tuesday at urgent care in Children's. It's in, we went there because the ENT was, go to urgent care. So we went to urgent care and the ENT was like, no, I can't see you today. And we had her wellness check with her pediatrician on Wednesday. And I was like, she said it came out, but I don't believe her. Pediatrician was like, no, still there. I got my try to get it out. But it is. She's gonna be like that.
There were kids, I mean, like soccer fields were packed.
Yeah,
And I'm like,
I know it's early and
Children's ENT got it out.
sometimes they happen during the snow. So I think you have to be prepared for whatever. it is.
But Jack was out of town.
Way too.
But usually his one thing for now, sir, you hundreds.
When they outside this, it's theirs.
That's something I need to work. And so I was like, well, it was stink, you know. And they listed it out, it's strong in my head. Yeah. If it's giving like, look. You are, you know.
And it's my wife's birthday.
How would you? That's like.
Oh, yeah, he's now. Super, you know, she said.
Maybe.
It was actually, his deal was much more the other way around.
Okay.
It was much more, she decided, okay, I think we can marry.
I think we got on 5 to 3 or 5.
My God.
Maybe.
Yeah, oh, yeah, no, he's good guy. In Hawaii, she wants to go destination one.
Aw. I just have.
Okay, that's,
Are you paying? Yeah.
no. When she said, I was like, you know, we.
Right?
You're like, it's a lovely plan.
Everybody else.
So, yes.
Okay.
Which is kind of the-
Mary, you back to Costa Rica. Okay.
Yeah, I went in February, which was a little early, but we got like $150. Yeah.
There's some.
Yeah. So just to like see the shot, especially if you're in that. Yeah. Well, it's annoying because they do it Saturday.
First, that's what the question was. I always said we want a family trip to Hawaii. That's not a family vacation to Hawaii. I'm just forcing it.
And she could always say, well, I'm gonna go back to work. You can say, you today.
We're gonna go down to Louisiana for a little bit. Costa Rica.
The family, you other something like that.
People. Where do you go? Really? Wow. Yeah.
When you-
How did you go to Steamboat? Yeah. I mean, I love Steamboat, but.
Federal paradise. They're not going there.
Steamboat, and the next thing you're going to ESP, I've never been to ESP. See you there. I'm friends. But. It's wonderful. It's cross country out there. Great things. I'm excited for that. And then. It's great. It's all right city. My parents and their retirement. Yeah, they're into ceramics. Oh, that's not easy. They're retired and they're like, we need to go to conferences.
It sounds fine when I didn't take this deal. That's like last year, that's sort of was kind of last week.
Yes, so great. Concerts ready to retire.
Oh, yeah, we're gonna get started, so y'all can continue eating. I'm just gonna, excuse me, going through these slides.
I know you weren't scam tech, I could.
I know it's part of my business. It's just part of.
Get me.
Actually, something that he didn't say.
Beautiful. Yeah, but there were.
We're gonna get started again, guys.
Yeah, let's get started.
Additional funding.
Because I think scenarios and the balance is important.
It is. That's what you do. Oh, I just. That was nice. How was that?
See you.
Keep eating. I just wanna, some of this is repeat, but I just really wanna point out, some of these considerations, in regards to our current environment. So delayed budget decisions and the finalization of grant awards at both federal and state levels are creating significant uncertainty. These delays have a significant impact on equity focused programs that serve priority populations. And additionally, there's a shift in focus addressing the funding gaps resulting from recent federal policy changes. So it is important and we'll continue evaluating that, but I keep repeating myself, but it's just, it's our reality right now. And we're gonna have to make, some changes and I wanna make sure that we're providing all the tools to be able to, give some really data-driven decisions to move us forward. Next slide. So funding watch. Like I said, we're monitoring the federal funding, the local and state, and these are some of the individual, programs that we're looking at as far as the funding, which is important. We'll continue providing updates even on my monthly budget report. You'll start seeing a little bit more of additional updates on what we're seeing. I'll add a section in there maybe towards, high risk or some federal, so y'all are aware of what's going on. So this is important. Next slide, please. So to address the current budget challenges, we're implementing several planned budget containment actions aimed at minimizing costs while preserving essential services, which is probably the most important. On the personal side, we will minimize non-essential hiring and explore potential changes to staffing and organizational structure to improve efficiency. We are also focusing on building a plan to support staff transitions, such as prioritizing internal hiring where possible. And for operational, we aim to minimize non-essential spending, including cutting back on training and conferences. And additionally, we're preparing for anticipated federal indirect reductions and develop a strategy to address that impact.
I don't know if folks heard that the feds are proposing a cap of 15% indirects. Our current indirect is around 23%, Armando? So we would need to find solutions to cover that. Sorry, go ahead.
Yeah, so in 25,
thought that was NIH funding specific. Is that every?
They're moving it, they're trying to move it to everything.
Everything. As an applicant, so we're just keeping an eye on that. So in 25, we plan to implement the PBB recommendations to create efficiencies and reduce expenditures where possible. And lastly, we engage, or Lexi and Endure are, engaging in advocacy and strategic engagement with federal, state, and local officials to ensure that our priorities are heard and supported during these challenging times.
And we have some staff that are doing some really nice work in that space, so. That's great.
Thanks. So yeah, the next two sections, I'm really gonna need your participation and engagement. So we're gonna move right into, the first activity is gonna be a group activity, and we have some things set up. But I want to talk about the scenario, these proposed scenarios that we're gonna talk about today. And so if you go to the next one, Patrick, I'm gonna give you slightly a little bit of information, and then we're gonna sit down, or we're gonna break up, or we break up as a group, talk about the scenarios. Based on just the information in regards to some of the funding that we believe are in reductions or not coming in as revenues. Also in regards to our federal grants, some of the county cuts. We are proposing three proposals right now, or three scenarios. One is best case reduction. The other one is likely what I truly believe we're going to be close to. And then the worst case scenario. So the first one is an 11% reduction, which I believe will be about 2.4 million. That is if we start receiving federal funding at its previous levels, and then sunsetting those additional grants that we knew that we're going to sunset at the end of. And then the worst case scenario would be a 35% reduction. And that is really taking 8.6 million in regards to our current, funding coming in. That is reducing overall 8.6, which would bring us down to a $15 million budget, almost 16, 15.8. Back to the 11%, that would actually reduce our budget to a 21.9 million as a base budget for 25. That's a rebase. Or sorry, that's a 26, but we'd have to start working on that rebase in 25. Keep that in mind. And then the most likely reduction, I believe, is about a $6 million reduction, which is about 25%. And you're looking at about 18,400,000 would be our initial starting budget for 26. The reason why I use 26 is if we don't address the base budget in 25, we would start using fund balance to address it in 25. Therefore, starting in 26, the discussion that we'll be talking about would be what is a good reserve policy? Where are you comfortable? Where should we use that reserve if we need to, once we run it through some of these priority-based budgeting. So
They're just so clear on that percentage reduction, that's based on a flat budget from 25 to 26.
So it could never be flat because, like I said, it's not as easy as cutting, that 24 million by 25. I just used it for our scenarios. It'd be around 24. I would say if I was a betting person, I'd be around 24 to 25% reduction overall, right? Looking at some programs might have a 5%. Some programs might see a different number, but overall, I guess, am I answering that correctly to you?
Yeah, I'm just like, what I'm trying to understand. So if we're saying we're taking a 25% reduction in the 26 budget, our baseline budget was the same amount as last year, 24.
Yeah, we always have to start with 25. Yeah.
Okay, that's what I just wanted to understand.
The only thing that I didn't add on here is that I think we need to rebase the 25. So if we rebase the 25, then that numbers would be, you wouldn't see that big reduction in 26 because we'd started in 25.
Okay, yeah.
Does that make sense?
The county, why is that based on 9.47 instead of 7?
So that includes not only our 7 million, but we also get the HHS.
No, this is about the 2.1 million that we didn't request this year because we had sufficient reserves to cover it. But that extra 2.1 million is what's actually needed to support our county funded staff.
What
So-
indications do you have that it will ever come back?
Yeah.
So that's why I just think that since we're looking at, you know,
So that's why we,
we're gonna ask for less, worse
Right.
case scenarios, shouldn't we be basing this county on the 7 million as opposed to?
It is, that's what the worst case scenario would be 2.1. I was in.
But the worst
the
case
others
scenario just puts us where we are now.
Today.
that's
Yeah.
right. But we have been given assurances
And we'd be getting the 7 million.
that 7 million is a base.
But if the county goes. Belly,
I have similar concerns that, I guess I'm wondering what, outside of what, assurances, like, have we heard that? similar
Yeah,
information?
you know, whenever we hear the county present to us, it's never a best likely scenario. So it's the worst.
I mean, we'll have this discussion during this. This is an opportunity. I really want to kind of discuss, how do you are we hitting a target that, are you concerned with kind of our assumptions? So what I'm hearing from you, Brooke, is, it seems like
Yeah, I
you
don't
probably
know
would be
about
more
the federal
comfortable.
or The state, the county, well, the state, those reductions might be on the low end too, but for the county. I think assuming that worst case scenario is that we stay at the 7 is really not a worst case scenario.
Yeah, that.
Unless they come and present to us this year and they have a different story.
But everyone's being impacted. It's great. Yeah, exactly. So it's hard to imagine.
So let's move on, and we're gonna have a discussion, but I just want to move on to the activity because I just kind of framed the
Yeah.
scenario for you.
Do you want to give that handout on the
Yeah.
assumption?
It's in the on the back of you'll see an activity.
I think that's a separate one, just in the folder, all the way on the back. In the pocket.
Back pocket.
In the pocket is where the handouts are.
And it says scenario. I think we have it called scenario.
Yeah.
Shorts.
Tip.
It's the last, so
The budget's there.
this one, there's a chart on this page
Yep, with the assumptions.
that includes how we arrived at those numbers for best likely and worst case. And totally open to those revisions. That's part of the board's job, is to help us figure out what the right scenario is, what we were working.
It's not this.
And so if you want to kind of just break up, we'll talk about it as a whole, but maybe discuss it within the small group. And there's some questions, there as far as, do you agree with those scenarios?
And I just, again, I heard you say that the likely is also a conservative estimate on the federal side? Or do you feel strongly that that's likely? Because I realize we don't have a lot of information, but.
Yeah, it's a great question. I would say likely is the 25 based on using the reserve that we used at 2.1 million as a supplement.
I'm just thinking about the federal cut of $4 million.
Is that, do you think that?
I think-
Likely that?
Yeah, I believe,
Out of 5.6?
yeah, out of 5.6.
That's a big.
That's a nice cut.
So the trick with the scenarios that we have
Yeah.
right now is that the utility of the scenarios are that when we get to the recommendations, we know what we need to be planning for.
Yeah.
And we're going to get to that stage in May. And so by May, I think we'll actually have a lot more information on what the best likely and worst
Yeah.
case scenarios for these are. So it's going to be a moving target.
Yeah.
This is just snapshot today.
These, the two that they proposed, so the reduction per capita and the family next reduction, those are actually proposed. Those are actually undergoing review in state level.
It's not finalized though, keep that in mind.
Yeah, but that's.
If y'all want to have some dialogue amongst yourselves, so then we can kind of do a breakout and talk about Agree with the assumptions?
I think assumption wise for me, it's just the county assumption and that likely case reduction does seem pretty high, you know. Bad. But I think being more conservative is good, and that's part of why the county funding should be more conservative.
And we'll continue having dialogue with them from the dialogue that we've had. I mean, they obviously can't guarantee it because it's obviously the commissioners, but based on the conversations I've had with them, it sounds like the 7 million is not in jeopardy of reductions, but of course, I want to be careful. I'm in a public meeting to come back and be like, oh, they cut it in half. But, you know, based on the conversations I've had with them, I would say it's a good possibility, but I could definitely, you know, when I start looking at these scenarios, we might want to make, you know, likely maybe a smaller reduction on that or, you know, $7 million reduction and then move, you know, a little bit more conservative on the worst case scenario.
I would also say for the federal, as we look more intentionally at those individual federal budgets and we do the high, medium, low risk assessment, that will incorporate that information into here. We just haven't done that process yet.
I mean, the key takeaway for me is the likely scenario of a 25% budget reduction in a single year is huge.
Huge.
Right.
That's like, that's not like a easy, yeah,
in the feds, but it's
yeah. You're right, even if it's 20%, it's a huge hit in a single year, so that's really just hard to swallow.
Recommendations, you guys do not see it that way as far as, you know, from what you're hearing? Because I mean, everybody's hearing something different, right? I mean, there's so much uncertainty. So this is strictly based on 2 months. You gotta keep that in mind, 2 months, and then also what we've not received in the feds.
I mean, I just keep going back to also the importance of communicating this with congressional representatives of an 80% reduction in our federal funding is astronomical.
Yeah.
Like we really need that. As we get more
Yeah.
clarity.
And we, some of our colleagues were on Capitol Hill the other day for public health. I think it was last week or the week before. And the messaging that they were getting from our Congress folks was public health needs to figure out what it wants to prioritize.
My question would be, when do you have to start reacting to this actually making these versus like how long?
So ideally would probably be before June because I think we need to address the 25 to rebase it to get to a 26. So even though the scenario is based on 26, I would say we'd probably have to do some small changes on 25 and use, you know, is it fund balance? What do we do? You know, I don't know that still we're still kind of looking at that, but I think we have to address the 25 rebase. So I would say end of May, early June would probably be cutting it, but that'd probably be as much time as we have.
So we think by the end of May, we will have a chance to look at the recommendations and figure out what kind of a package would satisfy each of the scenarios. We'll probably have more specific information on the best, likely, and the worst case scenarios, but we may not have a final clarity on the scenarios. But what that will tell us is it'll help us to think through the opportunities to reduce the budget in 25. How does that help with our reserves as we go into 26, and what do those projections look like? And that ties into our next conversation about how we use our reserves.
And I guess another question would be is, you know, what additional recommendations do you have for achieving this reduction target from the board?
Yeah, I mean, that ties into our reserves policy too. What,
You want to shore it up as possible, please. Absolutely, because the pay.
Well, and the reality is that the reserves are one-time use and the budget is
Just a gone.
Yeah.
And then if we do have another problem, well, but when the next disaster comes, then we have no reserves to draw on, nothing to get us going.
And not even our ability to count on the federal government to mobilize resources.
That's what I'm worried most about, that we will not have any additional backing if we make something.
you mean like the measles.
Like a music band.
Yeah, like that.
So.
It's okay, it won't be recorded.
Why we got the Sunday.
So we are thinking about supplementary strategies. How do we create a workforce architecture that supports surge responses better than what we have been able to manage for? And assuming that we're not going to get funding for it. In fact, assuming that our resources are going to be tighter. So, I mean, COVID was a stress because of the surge that we needed. And it came with a bunch of men. And what we're looking at now is a scenario where that surge response is going to need to be able to be tapped into, and there's probably going to be less money. So that's what that's kind of like, that's an example of an agency recommendation about how do we think strategically about our workforce and how we mobilize our workforce to be more flexible and nimble. What does it mean in terms of writing job descriptions? You know, do we want to put preferred qualifications? Are you an EPI? Could you be put onto an EPI team if we had an outbreak or things, you know, this is an example.
Yeah.
How do we know? And what I think the other thing I feel like we need to talk about is the realities of there's something where that doesn't square anymore and you can't actually serve the community need.
Mhm.
And so I do think we also need to be prepared with that message, which is if this worst case scenario occurs, this is what will actually happen in terms of what the county cannot achieve from public health.
That's right.
Because I don't want to I don't want us to try to squeeze a turnip.
Yep.
When it, you know, we can't.
And that's part of
so-
that feasibility testing,
Yeah.
communications plan that goes with it.
And I mean, we may or may not be able to answer something and to say we cannot serve that need. I mean, that's a terrible position to be in, but my preferences were ahead of that and we're clear on what that actually means and how that translates to the community. So there's no disappointment when and if that should occur.
I think that's right.
Yeah.
I mean, we have some departments that answer an enormous number of public questions that sometimes they're a little bit random and require work. Staff to really work to find out the answer for them. And I think, you know, thinking about like, how do we triage that?
Yeah. Right. And it might be interesting. I mean, I'm sure you're thinking about this already, but just running a war room concept through dire funding scenario and a serious public health problem, right? And what would that response look like? And I think it's important to prepare policy makers for that scenario. I mean, this is where it gets real, right? You start to really talk about, okay, we have another COVID. And how is that going to look different this time? Right. And some of those things could be positive, right? We've learned a lot. But I think it's important to bring this to light contextually so that nobody is surprised.
Yeah. Right. And I think that this is perhaps, you know, the new responsibility for emergency management teams just to think through some of that.
Yeah, some good postmortems.
Right. And then the messaging associated with that, right?
With an associated updated plan. Yeah, because if you do have to really fight for some of this funding, you're going to have to now present a plan.
Right. The pressure's on. I agree.
Yeah, so a couple thoughts. We are having workload discussions in that retreat tomorrow, where we'll be talking about boundary setting, because I think that goes to your point, like, what is it that we can do?
What services will not occur?
What services will not occur?
Or is at the level that they are now?
Yep, and so we're initiating these conversations tomorrow with all the supervisors. Another conversation is about prioritization. We do a lot of work in this agency and we really need to get leaner. And it may mean that we are not meeting the public every single question that they ask. But that's out of where we're gonna end up being.
Yeah, because it's the onus is on us to protect the staff too. It's
Yeah.
not just the community, but it's also the staff that are delivering these things. And yeah, I would really hate to see us unprepared to protect staff, right? If something really dire were to happen.
Well, we're really thinking of this as a long-term shift, right?
Yeah.
This is not,
Yeah.
this is not a crisis.
Yeah.
plan. And so when we talk about what is the new expectation, it has to fit with our staff's needs or it's not sustainable. It's part of the sustainability question.
Additional conversation in regards to the scenario or anything different that you'd like to see. I did hear, Brooke, I do have your concerns. Definitely make those adjustments. Is there any other one that you feel that maybe we missed the mark that we can make some adjustments as we continue looking at scenarios?
And Armando, I think just to Brooke's point and Morgan's point, I think just the assumption, I think, should include something around county. And it doesn't necessarily need to change the percentage, but more that could be a part of our assumption that we actually get hit on the federal and the county side at the same time.
I think, I've asked about it, Lindy's asked about it, but the benchmarking, are you having conversations with other counties, seeing where they stand and
It's hard to benchmark when it comes down to budgets, right? Because I think it's more on the services and how big they are, Yes.
what are their programs compared to our programs?
So this actually fits into, I'm sorry, can I take my puppy off? This fits into a larger strategic initiative that police and others are working on with the state on developing KPIs and what the expectations are for services. And I suspect that the state is leaning back a little bit and going, what does all of this mean in terms of what our expectations of local public health departments are, in terms of how many restaurants do they inspect? Do we start changing those KPIs? And I think that initiative is going to be really fantastic for helping us to all have kind of a level playing field. And it's like, if you can afford to go bigger, that's great. But at least we have some data on what the benchmarks are, because we don't have that information now and we're kind of collecting it idiosyncratic.
Yeah, and even just programs, right? What programs are offered county by county, right?
It feels like, just contextually, it feels like public health hasn't gotten the rest.
Yeah.
Right? So we went into COVID, and then after COVID is all the recovery, all the infrastructure. Armando and his team are rebuilding all the systems. They have done a phenomenal job. It just takes a lot of time. And then we go into this change in context. And it's exhausting. So I think if we don't start to set the boundaries and prioritize with the community and with others, I think it's never gonna, people are just gonna be burned.
We feel that as board members too,
Yeah.
Yeah.
We also feel like,
Yeah.
it's just one thing after another.
And that mean coming to the board and saying, hey, we are thinking about sunsetting these particular services, or in case you get flack from the community.
Well, I mean, I think broadly also that there's a delay between when cuts happen and when the community starts to feel the impact of those cuts, and that's going to be happening nationally. And
Yeah.
there are consequences to making cuts.
And I mean, the good news and the bad news is that Boulder County is not alone in this situation. I mean, we're all in this situation. And so,
Yeah, and there's broad public situational awareness of this as well, which is I think, very helpful.
And that we're trying to be as thoughtful as possible
Yes.
in prioritizing our budget so that it is not just a panicked across the board cut like we're seeing in some other levels of government.
Yeah, I was saying to Lexi, I am really glad we started this conversation when we did,
Yes.
because we needed it. I mean, we were gonna have to go into this conversation a lot more unprepared.
Another thing that just kind of add to these scenarios that, you know, based on the data that I looked at is, we're really going back to pre-COVID, 2017, very close. So keep that in mind.
Interesting.
You know, I think we've been there. I think the agency's been there. We just had this monster growth because of COVID and, you know, all this money and funding coming in. And so really it's realignment and really hopefully getting back to, it seems like pre-COVID, but obviously with some changes, right? But we got to be careful.
Some new programs that were high priorities for the agency and that I think are valuable programs. So I think it's a mix. I think it's a mix.
So we'll continue looking. We'll have another, you know, hopefully another month to kind of get some more assessment. And really the federal is really what's going to help us determine some of these scenarios. But I think when we come back, definitely at least have more information, not just assumptions. I think more of the data behind it. Then hopefully some recommendations is where we want to be. And then ultimately looking at 25, 26, that's what really makes it difficult, challenging, because whatever we do to 25, it affects how we're going to address 26. And so whatever we don't address in 25, we need to address it in 26, which may have more of a financial impact. So just keep that in mind. Either we kick the can forward or we address it and start, you know, 26 pretty clean.
There's one other thing that I want to mention that's important about understanding the context for the pre and post COVID budgets, which is that our salaries have gone up enormously since before COVID. We pay our staff much better than we did before COVID. Not inappropriately, but there was some work that needed to be done, both on pay equity inside the agency, but also with the keeping in alignment with the county, keeping in alignment with market. So when you look at kind of how our salaries have gone up over the past 5 years, it's a pretty significant difference. It's easily double digits.
And so that makes it more difficult because then not only are we looking at operational, but personnel. You know, what is a good mix? What does the organization look like? What efficiencies can we do? Because of obviously, you know, the inflation factor to personnel.
So when I look at this list, I feel like with the federal one, we have a good handle of what like all the different federal grants that we have and which ones have been pretty stable over time. I think where I'm a little bit concerned is in the grants one. Because grants that were once federal grants, particularly, I don't know if that includes federal grants. It's just state grants.
It's
Private
not
grants.
private.
It's private grants. Okay.
But those are going to have an impact because of the Fed. You know, everybody's going to try to go to be more competitive. So you got to address that shortfall also.
And I will be honest, grants is probably the space where we have the least data so far. Because it's more of a trickle down. It's like the feds affect the philanthropies thoughts, and the philanthropies are beginning to, you know, talk or not talk about what they're doing. In some cases, it even goes through the state. So this is a very preliminary scenario proposal. And I expect that as we refine it with data, that we will continue to come back to the board and give you an update on, you know, where are the scenarios anchored in data and where are we still really kind of guessing?
Yeah, because we're not gonna know without a federal budget.
Yeah.
Should have passed that budget in December.
That's being voted on March 14th.
Well,
That's the deadline.
It's the deadline or what I have heard on the news is that they'll likely do a continuing resolution till September to allow for them to pass a true budget with all of these cuts.
Continuing resolution is not good for us. No. But I think it's likely to be what happens.
no, there's no way they're gonna.
But I think that's kind of out of our control. I think what we have control over is really looking at, you know, some data and true, really looking at 25 and making some adjustments now, would be my recommendation. And then as more data comes in, as the revenues come in and we start trending, then we can start, addressing the 26. But I would definitely say that there's some early things that we can do with the 25 to get us at least a head start. And not being extreme. I think we need to kind of play it out a little bit, be patient, but at the same time, monitor our funding.
State, federal, we know that our county and our cities.
Also.
Yeah. And so, yeah, unfortunately, I didn't want to have that kind of news that came in last year thinking it wasn't going to happen, but, can't control it, so. This one's for real. So we're gonna move on to the last activity. And I think really this one is important that y'all engage because the reason why we're gonna do this next activity is kind of understand the reserve policy. Well, we understand the reserve policy that you adopted, but I think it's important now that we're in a position to make some adjustments and changes how we address those. So, I'll give you a little bit. I just want to make one. If you look at I gave you guys one balance, but we made a mistake because we kept moving these around. So if you look at the one that says 11% on here, that is the 35% scenario. And then if you look at the last page, which says 35%, that's the 11%. So just keep that in mind when you look at these. So this exercise is based on if we got the base budget for 26 at what we initially discussed at the beginning of 26. So that means we'd have to make some of these changes to 25, okay, to get there. So I'll talk a little bit quickly about if we did a 11% reduction. It's that last page because I wrote on it. So it's the last page. And we kept everything as is, and we dropped our budget down to that 15 million. What was the 15? Yes, that 21. Thank you. I don't have it in front of me, so I'm trying to. So the 21 million. We go into 26 with that budget. We drop that budget. Also earmarking 2.1 million, like we did this year. Let's just say we said, hey, we need this to fund some additional funding. That we would be at a 19% fund or a 19% reserve based on that. Okay, that is not adding any additional to fund balance. That is sticking to plan on 25 using the 2.1 and ultimately reducing it to that 21. So when we start 26, our budget would be 21 million, but we'd be at 19.5%. If we kept that the same thing moving forward to 27. With obviously only using the 2.1, we'd move it down to 6.7. Okay. Being consistent with that same budget, that 21 million budget. So that's scenario on 11%. I'll talk about the 12% or the 25%, sorry. On the 20.
Sorry, just so I'm looking at this.
Yes.
So the percent reserves that you just stated are the last. It's on the worst case reduction, but they're supposed to show up on the.
So just. The last page is 11%.
It's the worst case, right?
So
Best case.
They all say best case.
The headers
the headers are. That's the 11%.
Okay, so this is the best case.
Yes,
Yeah.
best case scenario.
Okay, so the back one is the 11.
Yes. And then go to the very first one that says 11, that should be the 35. Yes.
But the budget numbers are correct, right?
Okay. Yeah. So this is 21 million, this should be, yeah.
Yeah, okay. So they're all, okay.
They changed, the budget's changed.
Well, but look,
But the 11.
if this is best case scenario, should be 3 million down.
Yeah,
It should be
It would be because you have to add 15 plus all this other stuff to get to the total. So if you
But
go
is
to
the
the,
15 the base or is that I thought it was 21, then we have to add.
so this one, you'd have to add the 21 plus.
You want me to put it up there?
Yeah, let me pull mine up. This is when we had it.
Because I've got the handout open.
No, let me pull up the spreadsheet so I don't confuse you.
Yeah.
Okay.
Yeah, let's not confuse the articles. Let me pull it up.
Seven, like if we kept using the same amount of reserve.
Yes.
Yeah.
In the budget.
But there could be more changes, yes. Speaking out on that, it's just like if things held.
It's hard. This is how we.
All right, let me just close this out. Give me a minute. Get there. All right, so. So the 11% reduction should be. I might have to skip this one. Hold on. Let's talk about the fund. I'm gonna have to send this to y'all because I'm not too quick on the fly. I'm gonna mess it up.
I think the point of this exercise, this is the dot exercise.
Yeah, we're gonna do it now. I just wanted to give them a scenario.
Is to figure out what do we got?
But it is really important to know
How low do we
how
go?
low is the rate.
Yeah.
And that's what we're gonna get.
Yeah, I'm also just curious, like, I think it'd be helpful.
I think that one's kind of set. I think, we're gonna come back to the board in May with recommendations and as much of the scenarios anchored as we can. And come get back to you in June with the 26 proposed budget.
When we have to make personal changes.
And that's when we.
That's feel like the priority-based budgeting, the way that first conversation was, is it felt very incremental and
Yeah.
thoughtful. And now all of a sudden you're like, oh, but we have to make a 25% reduction next year. That doesn't feel incremental. That feels.
Well, we
It doesn't.
we don't know what we don't know,
Yeah.
right?
Yeah.
So we kind of have to wait for the data. I would say that we have to separate out 25 from 26. Right? We still have to figure out what the new base budget is for 25, because we know there's grants that likely will not get funded. So we got to figure out what's going to get funded. Yeah, and then there's areas, some of the grants are emergency management, things that we can't stop doing, right? So we're gonna have to start having those conversations eventually by now. But then 26 is the long-term plan. But the question is, what's the base budget for 26 that we plan?
So with that discussion, it's important, what I wanted to illustrate, and I'll have to fix those and I'll send them to y'all with this. Is that depending on what scenario we use, we're obviously going to continue using our reserve. 35% was below that 15%. If we kept it at that 11%, we had some room. I think it was 19%, but I have to fix those. And then ultimately, if we went to worst case scenario, we'd be at 6%. But at that middle 25% would still be slightly lower than the 15%. But with that said, is in order to do that, in order to get our base budget for 26, we're really going to have to look at the fund balance. And what I need guidance from this group here is we have a policy and I understand the policy. But what I really need to understand is, what are you comfortable with us using your fund balance? And so we have a list here and it's in that list is, for example, off-cycle grant gaps, right? We have grants right now that we know that end, but we have another grant coming in, so there might be some gap that we need to fund. Strategic plan implementation, yes. ROI opportunities, right? Investment in programs with the high return of investment. Short-term needs. Do we use it for short-term needs? Do we do one-time innovation fund? That is a one-time, but you never get it back, right? Efficiency investments. Do we, for example, is there a software that will, yes, help us do, our services a little bit different. Yes, accelerate things. Unfunded equity work. We have programs, as you've seen, that came up that, might not have funding. Is that a good way to use our fund balance, and contingency funds such as reserves, like unexpected emergencies? Keep that in mind. That's what we truly have it there for. But we're gonna have to dip into using this to balance a rebalance of 25 and hopefully move into 26 and have some type of guidance from this group to be able to tell us, we should be using it for one time, or should we only be using it for programs that maybe subsidize, 20% of a program. Those are the things that we need to hear from this group. And so we added those. And if you have additional ones, I'd like to add those first. And then I gave you all stars to be able to put dots of what is your priority. You have five dots to be able to go into each potential reserve use and vote. So I give you a little bit of time to kind of discuss amongst the group. Is there something we're missing there? Like one time is I would definitely always recommend reserves to be a one time, because it's not an ongoing. I definitely not recommend ongoing, because then it becomes that, that runaway payroll, that runaway, so it's like you can't get to it. So we want to make sure we address, that short-term need is my recommendation. But I want to hear from this board. I want your guidance. So when we start building these scenarios, we're implementing the guidance that you give us.
So I just want to give some examples real quick. So an example of a return on an investment opportunity is, do we need to buy a medical health, electronic health system, upfront costs, but then have annual, costs to run our Medicaid billing, right? It'll end up with money, but we're gonna have to put some upfront costs. Strategic plan implementation, most of the strategic plan has funding, except two of our strategies don't. Community engagement and the mental and behavioral health is gonna sunset through the ARPA funding. So just giving some, context there. And then the off-cycle grant gaps, this happens, right? There's gaps, we got to fill those gaps. They don't really cost that much money, but we have to hold, positions, so we don't have to rehire someone.
And that's a very traditional use of reserves.
Yeah. Contingency funds are in addition to the $500,000 emergency management funds, but that was something that was created within the last year.
And the contingency funds are a certain amount set aside every year to kind of take one additional requests from teams. Maybe we don't want to do that, or maybe we want to change the amount of what we build in as contingency funds, or lower the maximum that we would spend on that.
That's in your reserve policy that you adopted.
So any other questions? I just wanted to give some examples as to why we have these buckets.
It's, so I think first, when we think about this, we have to think, is this the new normal? Or do we think that we're going to rebound back up? And I think what we're hearing, again, just looking at county and city level, we're not. This is gonna be new normal.
This will be a one time.
So would we ever be able to replenish our reserves? Probably not for a long, long time. So whatever we spend of our reserves, we'd have to consider it gone. And that means if we have to when we have our next emergency response, do we have any funds to get it going? Potentially the holder through. Are there still the only,
And recognizing we may not get, a lot of times we put money up front for emergency responses and we get it back, but I'm not sure that that would be the case.
Well, emergency fund, we still have 500,000.
Yeah.
In emergency.
That, I'm on assignments, but yeah.
and so it's the only one up there really that would basically pay for itself is ROI.
What about or high priority projects that you think?
I mean, the only thing but I also don't see up there as an option is just filling the hole. I mean, what you've put in these scenarios is that like, we're not even gonna be able to reach our base budget without putting, so those all to me sound like these are extra things that we might in a normal year spend excess funding on. But yeah, like just meeting our basic budget requirements is.
Yeah, for X number of months.
Right.
We have to actually
So.
For this year.
Yeah.
For this year.
That's here.
Yeah, that's like what we did this year. Yeah.
So
We put 2
this year,
million.
But this is the I mean, we're gonna get ourselves into a pickle because we're just gonna spend it down and then it'll be gone.
Right.
And so we have to be really careful about that because this is not, I mean, to Brooke's point, this is going to have, this is gonna be years.
Because even a high priority project that has funding potential, that doesn't, you cannot refund your reserves from that potential funding. So
It's gone.
The question I have for you is,
It's just gone.
do you want to fill the hole?
Well, but for up to what?
it depends on
At
what.
what level?
Right, right. I mean, I
Yes,
think like
that's
what we
the
did
question.
this
I
year
mean,
is
do we
we,
want to operate as normal or do
What
we
we
want
we
to?
acknowledged this year was that we had excess reserves.
Mhm.
And that's why we put 2.1 million from our reserves into meeting our base budget. And I think that that is worthy of discussion too, like we spend our reserves until we hit that 15% to meet our
Exactly.
base budget.
That was the.
And then we stop spending our
Yeah,
reserves.
which I think we were all okay with, because 15%.
Yeah, it's just total.
But to me, that is meeting base budget needs. And then we have to readjust how we do our base budget, right? I mean, but.
Well, and I think that also goes back to the priority of the process we're going through now in priority budgeting, because we don't want to just meet the baseline willy-nilly. We want to meet the baseline that we know is a priority, that it is right. And then when we have a gap, we fill it up to a point, but we can't spend down all of our reserves. It's just not responsible.
I think you have a question.
Yeah, I just had a comment, and this is just on our reserves. Traditionally, the kind of funding we receive, we're not going to be able to rebuild reserves. So I would caution against planning on using $0.1 million to reach that.
Yeah, no, I don't think, no, I don't think so either, but I guess I'm
That was the
confused.
philosophy though.
No, but I'm also confused as like, we're not gonna be able to meet our base budget next year. This year without dipping, I mean, but we've already allotted 2.1 million for 25 and we might have to.
But it's gonna be, yeah, we're still gonna have a shortfall.
So, but like, it seems, I'm having a hard time wrapping my arms around like, well, let's fund ROI opportunities with reserve funding if we can't actually make our.
Okay, so what I'm hearing you saying
Yeah,
is that we want to incorporate those uses into the priority-based budgeting
Mhm.
scenarios and keep the reserves conversation separate.
yeah, I mean,
But we should,
I thought this was aspirational, like going.
It is. It is like,
Well, it isn't though, because we have to build at 25. So based on your guidance, I know that if we're going to, let's just say accounting is short 2 million. This is all hypothetical, right? What is priority? If it's because we need to buy a new system and it scored pretty high with y'all, then I know that, I can use that reserve for that. But knowing what I'm hearing from Morgan is if there's a gap in our budget, you'd prefer to address that gap and not be under 15% and keep the 15% reserve. So when I hear that, that means anything under 15%, you gotta do something, right?
yeah, yes,
Is that what I'm hearing is?
Yes.
that's how I feel
Yeah, I
about it.
I think we have to toe the line, like,
There you go.
otherwise we're gonna not have, I mean, I think the whole reserves conversation was about having reserves on hand, and it's really painful when we know there's a budget gap, but I don't like, that it'll start to toilet full because every year we're gonna feel this pull to use reserves to
No,
close funding.
that's
gaps.
why we
Yeah.
want a better understanding so we know when we're looking at rebasing and looking at 26.
Yeah, I know, you
What are
need to know,
some-
right? The board's gonna say, just clear it out, or, yeah.
so we have a question.
You all suggesting to use the reserves per your current policy until we get through PBB and we've addressed the innovation, the equity, the strategic priorities, and we know what our true base budget is. And then have the reserve, I'm seeing heads going both.
I don't think that's what you're
Trying to-
saying.
Well, I don't think that's quite what we're saying. I think we're saying, we want to maintain at 15% regardless. But then we could have a conversation like, if we are going to draw down to 15%, where would we put that money?
That
And
was
we
the intent.
And we could say, well, we would
Yeah.
I would prefer to put it in something with an ROI opportunity or an efficiency investment. Those are one-time things versus everything else.
so if
So I
I,
guess if we go in and we're like, we're gonna put it into this new program that we just started, it's like, well, but now you're just gonna have to cut it in a year.
Right.
Yeah.
Okay, so what I'm hearing is that the board wants to aim for keeping a 15% reserve and that all of those things can play a role in the priority-based budgeting recommendations as part of the strategy for how we get to a balanced budget, maintaining a 15% reserve.
Yeah, and then based on the various scenarios that you've, right, taken us into.
I think the intention was what Brooke was saying, which is that, as we get down to the 15%, we would just want to hear from you what you think is important as we move down to the 15%. And there are different pockets and different opportunities, and we just wanted to get your feedback, what it would be helpful for us.
Wait, we're now kind of saying, here's some money, because we're between 15 and 20 now.
Yeah.
And now we're trying to hard line
We're
at
at 20
15, and some of the staff is like, thanks for that 5%, which is totally fine. But then, like, my perspective on this is if we don't now toe the line, and we probably cannot revisit this ever again, because I think it's a weird conversation to be going back, to say, well, we've got this reserve over here and we're really kind of feeling the pinch. It's like, yeah, that's not what that's for. And so I think we have to be real. This should not be an ongoing conversation in my mind, right? Like there should be a policy. The board policy can be revisited, absolutely, but it feels strange to me to be merging this into the budget discussion. Like this, like the policy is the policy.
But what we
right?
did
And
this year is say, this is a $2 million, like, here's $2 million from a reserve.
Floater.
Yeah.
I mean, it's a floater, but it's gone.
But like, we didn't put any prioritization around it. We just said.
Yeah.
For sure. it's
Yeah,
$2 million.
I understand
Yeah,
the
yeah.
feedback. So we're saying if we're gonna drop to, we are saying we're gonna drop to 15%, and then if we are. Okay,
Right.
but
So let me be devil's advocate with that though, because I gotta I want to make sure we have guidance. So let's just say worst case scenario based on 2 months, this is only 2 months, we're gonna be $6 to $7 million short, okay? So what I'm hearing is you're willing for us to go down to 15. I think we were at 18. I think we finished off the reserve, right? So we have 2% to be able to salvage to try to rebase our 25. And the rest you're saying is you're not willing to go down 15%. So hypothetically, the 6 million, let's just say that extra 2 million that we have in reserves is 2 million. So you're saying is that we need to cut our budget by 4 million. Is that what I'm hearing? I just want to make sure I'm hearing it
I
correctly.
think that what the board needs to do is respond to what you come to us with, right? So like.
2025.
Right, if you're saying like, hey, we recommend that we're gonna cut, in these areas, we can trim, but we cannot trim anymore if we want to maintain our programs as it's this year. So we suggest using 2 million in this year, and then we're gonna figure out how to get rid of that need for the 2 million ongoing, because we know we're not gonna have it next year.
So it could be like, for instance, maybe we have a great plan for 26 and we want to start implementing it, but we're not going to be able to achieve the 26 budget immediately. And so it's a transitional cost.
Right.
Okay.
And what I'm hearing you say then is it's our decision.
Well, I would love to propose, so we will
Well,
react.
it'll be a budget amendment, right? So we have to rebase it 25. We have to bring this forward.
Contain what we're, in terms of where to put the money.
Not to where to put the money, but where to kind of say the reduction, will be at 15%.
What I'm hearing is that if we are proposing to use reserves, that the board would like a chance to hear about
Weigh in.
that and weigh in.
up to 15%. And then 15% is, I really feel strongly that we cannot keep bringing up a reserves percentage, because then it's not really a policy. It is just a thing that is continually pulled on. And I think creates more uncertainty for the staff. I think we need to be firm on it and say, this is the percentage that we are willing to go to, and that's it. And then you guys know, and then we won't have, this is creating more uncertainty on top of 1,000 other points of uncertainty. And I don't think that's healthy for this group.
Well, I think
I have a couple comments.
I would just like to insert just a couple of things. Is one thing is we're already pulling back from areas that we were going to use reserve for, right? So we have training, we have some personnel costs, so we're already pulling back and reducing what we were going to spend from reserve. And back to my point, if we cut back to 15%, we have things that come up. We are going to be forced to draw down below that 15%.
And I just want, we should be careful with the reserve.
Because this is one-time spending. So I would propose that there's some sort of cushion to that 15%, because if you start January 1st with 15%,
We could end up at 13.
yeah.
Oh, interesting.
Well, and I'm gonna play devil's advocate.
No, you're
for that.
good. We're here for.
Yes.
If we end up in a situation with a 25 or 35% budget cut, we're going to have to transition to that. It's not
Right, you can't.
implementable overnight. And we may find ourselves in a situation where the timeline for the implementation will push us into spending some reserves. And that's, I think that's the most likely scenario of what would drive us to being forced to spend the reserves. And maybe that's the best argument for why we don't want to incorporate any reserves into these scenarios to start with, because I think it's likely that the yes, I think it's likely that the implementation for some of those worst case scenarios is going to hit us.
Yes. And I think that's what we're also, I think that's what we're saying, is that none of this should be included.
Yeah, except for, again, like, I don't think we can go to the county and say, increase our funding, bring it back up to 9 million, but we're still sitting on 20% reserves. Like, I think that's what we ran into last year, was that we could not sit on 20%.
I don't think it matters what our reserves are, that money is being coming back.
Well, okay, yeah, but
But then the county won't give us.
And I'll take it still
They're-
gonna happen. I think
I mean, you
it
can
also-
still ask, yeah, still ask.
I also think it doesn't matter for a different reason, because I think we're gonna be at 15% by the end of the year period.
Yeah.
I don't think there's any escaping it.
It's just gonna happen.
Yeah, fine, great. I mean, I think,
On top of making changes, just to give you all, be
Sure.
realistic, not only are we
Yeah.
gonna be around 15, but we're also gonna have to make some changes
To get
to our organization.
yeah,
But that's also part of doing the scenario planning now.
Exactly.
Just so that the transitions can be faster. I mean, I think, you know, we're all members of the community, and if our neighborhood catches on fire, as we could, we want to make sure that somebody is there.
Yeah.
To help.
that's right.
And
Well, and we're going to be spending money in areas that, in retrospect, we're going to say that we wish we would have known sooner that, you know, this was going away.
yes,
So there's this period of unknown where we're going to be spending money that we might not get back.
I guess, I think one of the things I wanted to get out of this conversation was for us to have a better sense of what your priorities are in some of these spaces. But if you're comfortable, we will then propose how we would like to spend down the money in each of the different buckets.
I don't want to.
Right, but it's not like spending, I mean, that's what I think.
Well, we
that's-
don't know. We don't know yet,
Right?
right? We don't know.
It could be, but even in a best case scenario, it requires, what you've laid out is still dipping into reserves, even under best case scenario. And so I think what I'm acknowledging is that no matter what, we're gonna be sliding down that slope, and we don't want it to happen all at once, but we do need you to plan for it.
What I hear is that because we are in a situation where there are spaces where we're gonna have to spend reserves, don't plan to spend any reserves.
Yeah.
Because we need to stay at 15% if we can. That's a priority from the board, and it is a policy, and we haven't changed the policy.
How much is 15%?
On the 25, I think we have another.
3.6 or so?
That seems reasonable.
3.6 million?
I mean, it doesn't get to the 6 million if that's actually what we end up.
Well, it's enough money to cover a couple months of salaries, right? 3 months of salary, something like that.
3, 4.
Okay, I feel like this was a super helpful conversation
Yes, this helps.
and gave us a lot of direction. And I think we'll know a lot more too.
Be optimistic. I hope I come back.
gonna.
Just lottery and something like that.
I just want to say thank you to Armando. Yes.
I don't know why you're thanking me because the news wasn't good. So I can't tell you.
I just want to say thank you because I think it's just been a 360 from what we experienced. in the past. And It's just putting a lot of emphasis on planning in a way that we haven't been able to. So grateful.
There's a lot. Yeah, thank you, but I think it's just a team overall. We have a lot to do, so I'm gonna transition to Lexi. We're almost done. So bear with me. We'll get you out of here maybe 20 minutes early, hopefully.
Okay, so. Take a breath, breathe together, back to the inspire. Breathe together, inspire. You all have heard of information and we've gone down into the weeds and we've gone up into the sky and we've kind of done everything in between. And there is an enormous amount of work for us to accomplish in the next couple of months. And what we want to be really careful about is all of this very kind of disaggregated data and these minutia of recommendations and analyses and everything is to not miss the forest for the trees, to not get into a situation where we're making one-off decisions about specific issues that isn't put into a context of what are our greater goals as an agency. This, as we've kind of said, this feels to us like a new level set. And it's not going to be temporary. As such, we have to think about this work and its recommendations holistically and in the service of our long-term goals and mission as a public health department. And so we're going to be constantly kind of trying to re-examine, like, how do these recommendations fit together? How do they serve the agency that we want to be in 5 years? We just ask your patience as we go through that. This is not a process that's going to be fixed overnight. And we want you to know that we will continue to have these conversations about what is the agency that we want to be in 5 years and what does it look like and how do we think we can achieve that with the kind of opportunities and resources and creativity and innovation that this staff has in massive amounts. So thank you for your patience. Thank you for listening. I felt really good tonight about how people kind of really took in the tools before jumping into too many questions and kind of processed it. And I heard some people had some ahas tonight, which is great. And we have more work to do and we have some information from you to come back to. I am curious if the board wants to talk about any commitments that the board wants to make or any visioning or any additional conversations that you would like to have between more board meetings. I mean, we have kind of 2.5 months to do kind of getting these recommendations together and presenting you with, all the things. And what are the things that the board wants to do over the next 2.5 months to support your own effectiveness in this space? And how can we help you with that?
So this isn't probably a direct answer to that question, but I think we want to express that we understand that budgeting is a very cold and calculated way to talk about this. We do know these are people that we're talking about when we're talking about making budget decisions, and we're not taking that lightly. And it makes you really very like, we're all feeling these crunches, we're all in fields that are impacted by this, and we could all be hit in
You
the
all
same
have
way.
day jobs, day jobs where you're repeating the conversation.
But I'm just saying, like personally, we could all be hit with
Yes.
we're all having the same budget discussions within our companies. So we do fully understand and have great gravity that it is a human factor. budget too, just,
Yeah.
so a commitment to, we are thinking about that.
Yeah.
Too.
Right. And I think that was exactly what came up in my head as well. And I think, let's see, to the extent that the board, we can focus on what we can do as a board to support you and the staff right now. And I'm thinking about a couple of different things. The first would be, back to sort of the salary levels had gone up substantially since pre-COVID and, really thinking about, the impact to staff from a salary perspective. So, what can we do to support the staff through this period, recognizing they're going to have to do more with less? I think also towing a line around what we can and cannot achieve as an agency with potential budget cuts and vocalizing that to our stakeholders and helping you as a board vocalize that so that it's not just you having to deliver potentially hard messages about where we're going to be constrained. And then I think as much as we can support the public policy messages, that being active right now is to me the single most important thing. And so, signing letters, writing letters, showing up at legislative sessions, whatever you need for us to be more vocal, I think, I believe the whole board would be interested in advocating. So those are the things that pop to my mind as we think about ways in which we can support this beyond the Coles budget conversation, which is really important, but not the whole picture.
So I do think that those kind of rapid response turnarounds of the board to sign a letter, to endorse a position, I think that's really helpful for us because these things come at us really fast and we usually can't wait till the next board meeting.
Right.
So I think having a process in place, and we've got 3 letters for you to consider as soon as we have this process in place, that we'd like to get going pretty quickly, probably tomorrow. So, it's the best thing for us to do to send it to Morgan and is that how this?
Yeah.
Yeah.
Yeah, and then well, no, I mean, that's the thing is like, we actually,
You adopted policy positions, which is helpful.
yeah. And then, so if letters are in alignment with those policy positions, I should be able to sign off of them without having a full board review of each. Yeah.
Yeah, and I think, a lot of it right now is just basically support our agency's work, which probably is not too controversial for you. So we're happy to keep
Yeah.
that going.
So and I want to commend Rachel, actually, who brought this up today.
Yeah.
Because the recommendations are to have 3 letters, one to talk about the fact that we're not getting the money, right? That there are these delays, we're having to dip into reserves and the impact on the agency for doing that. The second one.
And these are letters to give
was-
federal.
Yeah, to federal partners. The second one,
How the orders are impacting that we're doing in our community.
yeah,
And the other one, I think it's future cuts. We did lose so on my team, we had a CDC public health. We've had 9 of them in the past 8 years or so in our agency, and they're fellows through the CDC. And that person was let go, and it's really unfortunate because the CDC prioritized hiring veterans this last go round, and our employee was a veteran. And we are going to be opening a temp position that we're hoping that she applies for so that we can bring her back on our team. We planned for that to happen and didn't hire another position.
well, and so Rachel's team actually sent a letter to the congressional delegation saying, this is a veteran, this is a person that we were, this is a historical component of us having these PHAPs and training them and coaching and mentoring for the next generation. So I think it's letters like that that are going to be really important for them to have good understanding. The congressional delegations are also holding town halls. So I think Michael Bennett actually had one tonight. So that might also be another.
Patrick and I are also talking about providing some kind of maybe inter-board meeting update to you all, like every other week, the kind of the midpoint between the board meetings, just to give you kind of a status update on the policy changes, the budget impacts, things like that, that could be just high level, but just keeps you kind of at least a little bit in touch with what we're dealing with and what we're hearing too. which I think is a nice compromise because once a month feels like a long time right now. Usually we would say, "Ah, that Board of Health meeting comes around so fast. We should move to bi-monthly." But the reality right now is that things are changing so quickly that I think being able to send a memo to you every other week or that interim.
Yeah, as there are updates to share, I would also invite board members, you know, I have a standing meeting with Lexi, which we talked about once a month, which if one of you can join me, or I can give up my seat if two of you want to attend that. So that's another opportunity for.
Yeah. And that meeting is typically the Wednesday after the Board of Health meeting, and it includes both kind of a debrief of the board meeting and an anticipation of the next month's meeting.
And then Brooke and I also have the budget subcommittee meetings where we try to give updates. So what I want to be cognizant of, Lexi, is that you have so much on your plate. I don't want you to write up something separately that couldn't be covered already in like a standing meeting where Brooke and I could distribute that information if it's relevant.
Yeah, okay.
And some of it too will be trying to consolidate the info we sent, because I looked last week, it's like, I sent you guys 3 emails, like, in the course of the day, so like, we could try to consolidate that and combine it with some updates.
Yeah, I think it also has to do with kind of like ongoing scheduling needs.
Yes.
And things like that. So little drips, drips that could make it more efficient to just communicate with you.
The other thing I wanted to mention, Brooke, that you brought up the staff, right? And we have set up a internal mental health consultant who helped us during COVID. And has been kind of vetted by our LGBT community within the agency as being very LGBT friendly. And given everything that's happening, both on the immigration front and the sexual orientation and gender identity front, and then on the budget fronts, we will set up weekly meetings for him to hold that people can opt in. And that's just a space for people to be able to share concerns, and he'll work with the staff on how to maintain resiliency in times like this, which I think we all need, right? Frankly.
I think one other thing to put on your radars is I know that electeds really appreciate thank you notes. So like, I know Sherry Giroux has gone to bat, Judy Amabile has gone to bat for local public health. So as they're wrapping these things up, they really appreciate getting that even 3 cents. Thank you for protecting public health. This is what it means to my community. And they do remember those things. I just remember as a lobbyist, that goes a long way after they get their letter and they take action. So
Yeah.
something else to consider.
And I recently met with Judy's staff, and she's on the JBC, and met with Kyle Brown and one of his staffers today. He's the chair of the health committee. So Boulder County has some amazing advocates at the state level in this space. And I know that Joe Goose and Michael Bennett and
They're all on the
have been
right side.
have been saying, send us examples, send us stories, send us the words that we can repeat. And so I think being really intentional about that is helpful.
Yeah, definitely send them the story about the veteran. Because that also came up in the local committee with Kimber recently, right, about the impacts on veterans.
Awesome. So I want to repeat what Indira said. We have a lot of staff that have worked hard on this, especially including Armando, Desiree, and Sarah. Also Jerry. Our management team is wading deeper into these waters, and we thank them for really bringing their best ideas and their positivity into the space. We know this is really difficult, and we are doing everything that we can to be intentional about getting ahead of the ball, and making it as smooth a process as we can, as a fair process, a process that supports our community, and also supports our staff as we move forward. Thank you also to the Board of Health. All of you were here tonight in person.
Thank you.
And you stayed the whole time and participated actively, and you don't know what that means. It's really appreciated, and we have a great brain trust here that we lean on and we rely on, and I know we'll get through it together. We may look a little different, And we'll all do our best. We'll continue to do our best day after day.
When you say look a little different.
Older.
A lot of great.
Nice.
Because I feel like, yes, that was.
Wash that out of my head.
Yeah.
Since I started this morning.
Lexi, thank you for your leadership.
Yeah, thank you.
This is a really hard time, so thank you. And thank you for being positive and reminding us to see the bigger picture. That's really important.
And Armando, thank you for not quitting, Sarah.
Not yet.
Don't you want to close this out?
Yeah, well, I mean, I started by saying, that I felt like we're in a much better place than we were a year ago, and we are in so many ways in terms of our infrastructure and core ability to weather what is going to be a rough year. And I, you know, it is much easier, I think, to set sort of these like boundaries or things, priorities that we feel as a board. Is much harder to actually make that happen on a budget. So I know that you all have your work cut out for you in the coming months. And it's much easier to respond to something than it is to come up with something ourselves. So, but I think what we also wanted you to know is that we trust your recommendations. You know, yeah, we know that you all are doing the day-to-day work, and we want to hear from you what you think needs to happen and how to prioritize. So we appreciate having a really strong structure in place to go through our process. We have trusted in you and all of you, really. So thank you. Thank you. Yeah. Oh, yeah.
Adjourned.
Adjourned.
Yeah. Thank you.
Thank you.
Yeah.